And welcome to the public witness hearing specifically for American Indian and Alaska Native programs under the jurisdiction of the Interior and Environment Appropriations Subcommittee. I especially want to welcome the distinguished tribal elders and leaders testifying today and in the audience. Most of you traveled a long way to be here this week. I hope you'll seize the opportunity to meet with other members of Congress outside the subcommittee to remind them that honoring the nation's trust obligations is a responsibility shared by all members of Congress, regardless of our state or congressional district. I assure you that your voices are heard by this subcommittee. For those new to this process, today's hearings are just a start of a dialogue we've come to depend upon to make smart choices in the budget and to earn the votes of our colleagues. American Indian and Alaska Native programs will continue to be a nonpartisan priority for this subcommittee, just as they've been in recent years under the chairmanship of Democrats and Republicans alike. Before we begin, I want to have a little bit of housekeeping items to share. Committee rules prohibit the use of outside cameras and audio equipment during these hearings. The hearing can be viewed in its entirety on the committee's website, and an official hearing transcript will be available at gpo.gov. I'll call each panel of witnesses to the table, one panel at a time. Each witness will have 5 minutes to present testimony. Your full written testimony will be introduced into the record. So please don't feel pressured to cover everything in 5 minutes. Finishing in less than 5 minutes may earn you some great brownie points, so think about that. We'll be using a timer to track the progress of each witness. When the lights turn yellow, the witness will have 1 minute remaining to conclude his or her remarks. When the light blinks red, I will have to ask the witness to stop. We'll hear from every witness on each panel before members will be provided an opportunity to ask questions. Because we have a full day ahead, I request that we try to keep things moving in order to stay on schedule and respect each other's time. I'm sure many of you have planes to catch. With that, I'll thank you again for being here today. I'm happy to yield now to our distinguished ranking member, Betty McCollum, for her opening remarks.
Thank you, Mr. Chair. And this is a very, very important hearing that we have. And there's other members flying in, but your full testimony will be given to them. And I'll be briefing the Democratic members as Mr. Cole and Mr. Calvert will be talking to, well, we all talk together. We're very nonpartisan when it comes to Native American affairs. So I welcome you all here, Mr. Chair. Thank you again for holding this very informational hearing the next 2 days.
Thank you. So we're going to start with the National Indian Health Board. Vinton Hawley, the chairman. You're recognized for 5 minutes.
Thank you for your time. Chairman Calvert, Ranking Member McCollum, and members of the subcommittee, thank you for holding this important hearing and allowing me the opportunity to be here today. My name is Vinton Hawley. I'm the chairman of the National Indian Health Board, and I also serve as a chairman for the Pyramid Lake Paiute Tribe in Nevada. Today, I would like to offer recommendations on fiscal year 2018 budget for the Indian Health Service. As you are aware, the health status of American Indians and Alaska Natives continues to be among the worst in the country. Historical trauma, poverty, lack of access to healthy foods, loss of culture, and many other determinants of health all contribute to the poor state of American Indian and Alaska Native health. We live on average 4.5 years less than other Americans, but in some states that is 20 years less. But none of these challenges alone is as damaging as financially starving the Indian health system. All of these determinants of health and poor health status could be dramatically improved with stronger investments in the public health and health delivery systems in Indian country. In 2016, the IHS per capita expenditures for patient health services were under $3,000 compared to almost $10,000 per person for healthcare nationally. America needs to keep its promises to American Indians and Alaska Natives and fully fund the IHS. Tribes are grateful for the recent increases to the IHS appropriation over the last several years, but note that the increases have not allowed for expanded services, but mainly keep up with inflation and population growth. NIHB supports the budget request of the National Budget Formulation Work Group, which is comprised of tribal leaders, technical experts from across Indian country, for FY 2018 tribes recommend fully funding IHS at an estimated $30.8 billion, which includes amounts for personal health services, wraparound community health services, facilities, and capital investments. We understand that getting $30 billion appropriated this year may not be possible in the current budget environment, so we recommend that Congress phase this in over 12 years. For 2018, then, we recommend $7.1 billion for IHS. The work group's fiscal year 2018 request has 5 top priority areas: purchase referred care, hospitals and clinics, mental health, alcohol and substance abuse services, and dental services. These are real lives at stake. A father from Northern Cheyenne reported that his daughter was born prematurely due to her mother's struggle with methamphetamine. The child battled for its life and caused trauma for the whole family and community. He said, "Meth abuse doesn't just affect 1 or 2 in our large extended tribal families, it affects everybody. The services available on the reservation weren't helpful to my needs nor to my family. This is just one example of why the money that Congress provides means life and death for our people." Congress should also encourage programs at IHS that are culturally informed and locally driven. NIHB spoke with a young woman from the Oglala Sioux tribe who courageously shared her story about multiple suicide attempts. She went into an inpatient facility in Rapid City but did not feel she received healing. It wasn't until she attended a Lakota cultural healing camp that her life turned around. She said, "It made me feel powerful. I got to learn about my culture and it made me feel closer to who I am. But the camp operates through donations and community support. These are the types of programs we should be encouraging with predictable, sustained funding. Congress, please take the courageous and ethical step of adequately funding health care for this country's First Peoples." While we understand that the jurisdiction of this committee is annual appropriations, I must mention the concern tribes have about potential cuts to the Medicaid program. Medicaid represents a substantial part of IHS third-party revenues. Current proposed changes to the Medicaid program outlined in House-passed American Health Care Act will mean less services for our people and increase pressure on the severely underfunded IHS. We encourage the committee to stand up against these Medicaid cuts. IHS and tribal facilities are seeing referral dollars go much further thanks to Medicaid funding. These drastic cuts in Medicaid will only result in more rationed care and poor health outcomes for our people. I would like to close with a quote from Geraldine Church, CEO of the Great Plains Tribal Chairman's Health Board. Last year she stated, quote, "We make up 2% of the entire population of this country. We are the genocide survivors. It is not a big ask to ask for this country to fund schools, health, or judicial systems at a level that allows us to live functional, healthy lives," end quote. In 2018, NIHB, on behalf of the 567 federally recognized tribes across the United States, calls upon Congress to fully commit to funding our health services by enacting a robust budget for IHS. Thank you very much for your time.
Thank you. Thank you for your testimony. Next, how to pronounce that? Yatabe Evans.
Good morning.
Good morning.
Hi, my name is Yeti Bay Evans. And good morning, Chairman Calvert and Ranking Member McCollum and members of the subcommittee. Thank you for this opportunity to provide testimony on behalf of the National Indian Education Association. NIA is the only national organization advocating for improved educational opportunities that enable Native students to thrive in the classroom and beyond. We equip educators with the knowledge and tools needed to support our Native students in reaching their full potential. We also offer professional development opportunities, policy and advocacy assistance, as well as educational resources. I currently serve as the president of the board of NIA and am honored to be the first Alaska Native president in the history of the organization. I'm happy to be with you today to talk about the needs of more than 650,000 Native students across the country. Over the past year, the Every Student Succeeds Act has begun to be implemented within our states, leading to changes in how leaders in states across the country, from Oklahoma to California to Alaska and Minnesota, think about how to best educate our students. NIA has been leading the way, working with tribes as well as chief state school officers to make sure that we seize the opportunity that ESSA provides, greater local leadership to improve educational outcomes for all students. including American Indian, Alaska Native, and Native Hawaiian students. The subcommittee's work on fiscal year 2017 appropriations shows that you understand the importance of providing funding to improve BIE schools. Thank you for holding firm and including increases in several key areas. Here are our fiscal year 2018 recommendations. Our written testimony contains quite a few details, but I'd like to highlight four of them in particular. First, BIE school construction. We're asking for $263.4 million. I asked for this increase first and foremost to meet the needs of our Native students. NIEA recognizes that there are administrative issues with fully appropriating BIE schools' construction list. However, our students should not suffer and be expected to learn in dilapidated buildings. Far too many BIE schools are not in adequate physical condition to put Native students, or any students, in schools where students should be able to succeed. Numerous examples have come to NIEA's attention over the last year. There are schools without air conditioning, broken windows, wiring that's uncovered, ceilings and floor exposed. We simply must do better. NIEA requests $130.3 million above the fiscal year 2017 amount to fully fund construction and repair. Second, we'd like to ask for $431 million for the Indian Equalization Program. ISEP funds provide the core budget amount for BIE elementary and secondary schools by covering teacher salaries, aides, principals, and other personnel. Unfortunately, ISEP funds have been reallocated to cover the program funds in other areas of education. ISEP must have adequate funding to ensure all program needs are fulfilled and must not be reduced to provide funds for new initiatives that have not been vetted by tribes. NIA recommends $30.78 million above the fiscal year 2017 omnibus. Third, I asked for $5 million for BIE immersion demonstration grants. And I want to thank the chairman, ranking member, and subcommittee for the $2 million in the fiscal year 2017 bill. It's well documented that Native students are more likely to thrive in environments that align with their culture. The immersion program will support Native students to strengthen their language, improve academic outcomes, and become future leaders of their tribes. We recommend that BIE immersion demonstration grants be a line item moving forward with $5 million appropriation. Fourth and finally, we ask that you continue the investment and oversight for and of the Bureau of Indian Education so that BIE schools that serve all Native students who are able to attend them well and served appropriately. The BIE's ongoing work to reform and better serve Native students is critically important to tribes. In conclusion, fiscal year 2018 funding has the potential to translate bipartisan commitment to improving BIE school construction into action. By ensuring that all schools have the facilities and resources necessary to provide a 21st century education, Congress and the nation can reverse the challenges BIE faces and address the needs of our Native students. The over 43,000 students who depend on BIE funding deserve nothing less than full funding for the schools they need to realize their dreams. Thank you for this opportunity.
Thank you for testimony. Next, Carrie Billy. President and CEO of the American Indian Higher Education Consortium. You're recognized.
Yate Bene. I am Carrie Billy, the President and CEO of AHEC, the American Indian Higher Education Consortium, and on behalf of the nation's 37 tribal colleges, thank you for your past support. Your investment is yielding a remarkable and proven return. It's transforming families, communities, and tribal nations. It's helping us serve more than 160,000 American Indians, Alaska Natives, and others each year through academic and community-based programs at more than 75 sites in 16 states. Our requests today are fairly modest, and they're outlined in our prepared statement, so I'll just mention two. An additional $10 million for a total of $80.2 million for institutional operations and technical assistance under Titles I and II of the Tribal College Act. That's all that's needed to provide funding at the fully authorized level for 27 tribal colleges for the first time in 37 years. So $10 million, 27 tribal colleges, first time in 37 years. I can guarantee you that you will not get a better return on your investment anywhere. Need proof? It's right here in this independent report. I don't have time to talk about it, but here it is. Overall operating funding for these 27 tribal colleges hasn't increased for 4 years. In that time, 14 of the 27 colleges have seen dramatic enrollment growth. 3 schools are up 20 to 30%, 2 are up more than 40%, and 1 has more than doubled its overall enrollment in just 1 year. Plus, we have 2 new tribal colleges joining the funding pool, College of Muskogee Nation in Oklahoma and Red Lake Nation in Minnesota, adding hundreds more students to an already stressed overall funding formula. So our first request, $10 million additional for Titles 1 and 2. It's time and it's a proven investment. Second, thank you so much for working with us over the past few years to ensure that IAIA, Navajo Tech, and United Tribes receive their operating funding on an academic schedule. It's had an enormous impact on their stability. Now only 2 schools under the Department of Interior are not forward funded. They are fully owned and operated by the BIAE, by the federal government. That's Haskell in Kansas and SIPI in New Mexico. Please help us through report language and good old arm twisting, encourage the administration to find the resources to transition its own institutions to a funding that's based on an academic year schedule. How can we expect our schools and colleges to create miracles, deliver world-class educational programs, and prepare the next generation of scientists, teachers, and entrepreneurs if they have inadequate operating funding and can't even develop a realistic budget every year? The answer is simple: we cannot. If we want excellence, let's at least give our tribal colleges the tools they need to strive for normal. We'll take it from there, from normal, commonplace, ordinary. We'll create miracles. We'll create transformative change. I know because I see it happening every day at tribal colleges. Just last week, I attended the Sitting Bull College commencement on the Standing Rock Reservation. There at Sitting Bull College, I saw the future of Indian country, hardworking, passionate, proud, and committed to change. 53 graduates ready to enter the workforce to join the Standing Rock government or tribal council, many of whom are already graduates of Sitting Bull College or students. Or enter the private sector and help grow the local economy. Last week, Wiyanka Chasing Hawk earned a vocational certificate to operate heavy equipment. He gave the student benediction at the ceremony in his Lakota language, asking for patience and strength for all the graduates. Bridget Eagle, a longtime employee at the college, earned her degree in business administration. She was especially proud because her daughter also earned a degree last week. Then there's Shailene Taken Alive LeBeau and Tanya Wanner, both cum laude graduates ready to educate young Lakotas with their bachelor's degrees in elementary education. Harriet Blackhoop is all set to help address the challenges, the water challenges on Standing Rock with her certification to be a water technician. These individual students together will transform Indian country. Over the course of these hearings, the committee will hear of the many challenges we face as Native people. These challenges are real and serious, but as you listen to the stories, please remember the tribal college students for whom no challenge is insurmountable. Our students, with their resilient ability to look back and hear our stories and songs, have our history and language with them, and they have the tools and the confidence to shape a better world on our own land. Tribal colleges gave them that transformative power, whether it's through an opportunity for a healthier life, through innovative public-private or community-based research projects like our NIH-funded NARCH grant, a more prosperous community through public-private partnerships like our Advanced Manufacturing Initiative, or revitalizing Native language and cultures through tribal college-established K-8 immersion schools right on the college campus. Tribal colleges are there building a stronger future. Mr. Chairman and members of the committee, thank you so much, and staff, for your work to sustain and strengthen the best experiment and experience in tribal self-determination ever, and one of the best investments in the federal government, tribal higher education. Thank you.
Great. Thank you, and thank you for your testimony. We have another Carrie Whitlow, Treasurer of the Tribal Education Department's National Assembly. Welcome, and you're recognized for 5 minutes.
Morning. Chairman Calvert, Ranking Member McCollum, and members of the subcommittee. My name is Carrie Whitlow, and I'm an enrolled Cheyenne-Arapaho tribal member. I serve as the Executive Director for the Department of Education, Cheyenne-Arapaho Tribes. I'm also the Treasurer of the Tribal Education Department's National Assembly, TEDNA. TED is a national nonprofit membership organization for the education departments/agencies, TEDs, of American Indian and Alaska Native tribes. Thank you for the opportunity to speak today about funding for TEDs. We appreciate this subcommittee's commitment to Indian education for appropriating funds for the past 3 fiscal years to support TEDs through the Department of Interior's Title 25, Section 2020 grants, and for providing increased federal funding in fiscal year 2017. This subcommittee clearly values the crucial role of TEDs in providing, supporting, coordinating education programs and services to Native American students. To continue this vitally important work, TED respectfully requests $5 million to support TEDs and the Department of Interior, Environment, and related agencies' appropriations bill for fiscal year 2018. Since the 1970s, Congress has stated a policy of supporting local, tribal-controlled, many formerly federally run programs and services for Native Americans. Pursuant to this sound federal policy, in 1988, Congress authorized Section 2020 funding for TEDs to coordinate and develop tribal education programs and services. However, it took more than 25 years for funds to be appropriated. There are currently 11 Section 2020 TED grantees whose vital work and initiatives under these grants are just getting started. I would like to briefly highlight one example of the important work the Section 2020 Grants Fund for my more extensive written testimony submitted. The Leech Lake Band of Ojibwe in Minnesota TED serves students attending 8 state public schools as well as 1 BIE-funded school. The tribe is using its Section 2020 grant to develop a tribal education code and a comprehensive education plan that will be culturally specific to Leech Lake Band of Ojibwe. In this process, Leech Lake has actively sought the input of the community, including students, parents, and caregivers, on the community's most important challenges and what is needed to foster student success. Not surprisingly, many have voiced a need to be culturally supported within their school. As one student framed it, education not only in the sense of a school setting, but also our cultural ways and our language. The feedback from the local tribal community has led to a multi-pronged approach to policy and capacity building. This includes gathering data on the fields post-secondary students are graduating within, working with the Tribal Workforce Development Division to identify current and future workforce needs, and coordinating with state agencies to ensure family financial stability so that students, parents, and caregivers can focus on education. Activity funded by its Section 2020 grant has strengthened the tribe's relationship with outside entities. It was a catalyst for Leech Lake's involvement in areas beyond its grant. This capacity building is precisely what Congress envisioned when it enacted Section 2020 grants. As my written testimony more fully explains, Section 2020 grants enable TEDs to 1, support early education initiatives and develop culturally relevant curriculum, 2, increase tribal participation through providing coordination, administrative support services, technical assistance to schools and education programs, and 3, develop and enforce tribal educational codes, policies, and standards applicable to curriculum personnel, students, facilities, and support programs. These are core educational governance functions that are most appropriately left to the local government closest to the students being served, the tribes. Section 2020 grants help facilitate local tribal control of education. Thank you for the invitation to testify today. I ask that my full written testimony be made part of the record, and I'm happy to answer any questions you may have.
Thank you. Thank you for your testimony and all your testimony. And obviously, education is a high priority to this committee, and I hear you on new school construction. This entire committee, we're very concerned about that, and we're trying to figure out where to get the resources. Obviously, our demand is a lot more than the $200 million you're asking for. It's in the billions, and so we're going to hopefully come up with a solution to this problem, but it's not lack of trying. Any other questions or comments? Ms. McCollum?
Just really briefly, thank you, Mr. Chair. Mr. Halley, there was a brief news clip when I was getting ready to come in this morning talking about how internationally young adults, and they were using, I think, 10 to 18-year-olds, were living longer. In other words, they were doing better. Have we seen with some of the interventions briefly, and do you have a list of interventions that are working on some of the suicide prevention? You gave one example, but if you have more that you could give to the committee to make sure that we're appropriately funding programs. And I'm just going to, because I'm going to be really quick on what I'm asking is more for supplemental. Thanks for your appendix, it's great, Ms. Evans. But Ms. Billy, do you have a copy of that to enter into the record, what you were saying? And then, do you know if you're able to come up with a number of NIH grants that the tribal institutions have been using to supplement and enhance their program dollars? Because that NIH is, zeroed, some of the federal grants that you also use that have been zeroed out, whether it's the arts or the humanities or the sciences. If you have that information available, if you could share it with the committee.
We can definitely do that. There's a great program at NIH called the Native American Research Centers in Health, something like that, that has just a little bit of funding, but extremely helpful. So we can get you that list.
And by the way, we'll
I
introduce that
misspoke.
report into the record and any other
Yeah,
issues.
NIH, it's NEA and the humanities that have been zeroed out, not NIH. But Mr. Cole is fighting for every penny he can get. So any arrows I can put in his quiver, I'm ready to do. So thank you.
Great, we will. Thank you.
Speaking of arrows, Mr. Cole.
Oh, it's always good. My friend stocks my quiver pretty well every year. So I just want to actually make a couple of comments and just to get them in on the record. Number one, thank all of you for being here and thank you for your testimony. It's extremely helpful to this committee. As my good friend from Minnesota suggested, there are other pots of money out there that it doesn't all come to Interior. We've actually done pretty well in labor age the last couple of years, and President Obama chose to pursue a number of his youth initiatives through that particular thing. And because we've got a much bigger jurisdiction, we got a bigger pot of money, and we're able to do maybe a little bit more. I think that's the big challenge this committee has, is just what our overall allocation is. I mean, I don't know how we're ever, number one, I don't know how we've done as much as we have the last few years in some ways, because all collectively, both education and health, have been the top priorities on this subcommittee, and honestly have gotten more new money, even in a shrinking budget, than any place else. But unfortunately, the chairman does have to think about how he runs the National Park System and the Bureau of Land Management and a myriad of other things that are under our jurisdiction with a fairly limited amount. So there's two things I'd like to suggest we figure out, Mr. Chairman, how to pursue. One would be on the health programs. We're never going to catch up as long as this is all discretionary spending. That's just a huge problem for us, and I think it's really, from what I can determine, really rooted in the fact that the Indian Health Service predates Medicare and Medicaid by many decades. That's the way we used to do it. And so that was a system functioning, and we saw the consequences of that, frankly, during sequester, where because they were outside the mandatory umbrella, they took cuts that no other health programs had to take, and that really put extra burdens on tribes. So, one, we need to see if there's some way legislatively that we can do something, and that takes care of a lot of our issues with forward funding and a lot of other things. The second one, honestly, I approached with some hesitation. You and I have mentioned it occasionally. While I want to keep the jurisdiction of this committee intact, on the other hand, we just simply have more money at Labor H, for instance, than this committee does. So, if Indian Health Service, we have all the rest of Health and Human Services except Indian Health Service. And the chairman and I had the opportunity, we actually visited with Secretary Price. He's got a vast agency. I think this is sort of new to him. And when we took him the figures of which you mentioned, Mr. Howley, in your testimony, per capita Native American health funding with everybody else, I think he was genuinely shocked. He really did not know. That's no disrespect to him. I mean, there's not a tribal presence to speak of in Georgia, so it's not something he would particularly know about. And he's certainly committed to work with us and try to help us. But with the best will in the world, there's only so much money in this budget. And we could probably find an extra $1 billion or $2 billion in 100.
We'll move it over to your jurisdiction as long as I keep the money over
honestly, not all of them. Send the money with it, and I'll add money on top of it. But I just think there needs to be some way to look at these things, because I think we're going to be, perpetually, trying to catch up until we either get a larger pot of money, particularly in the healthcare area, or we find, and maybe it's a combination, some way to transfer some of these responsibilities into the mandatory program so that there's a larger, again, pool of money. Because I really worry this year, particularly, none of us know what kind of allocations we're going to get. That's going to be very difficult to continue the progress we've had, let alone catch up on the very legitimate needs. So let me just end with this. I invite any of you out there legislatively, if you've got some ideas about how to proceed. I see Katrin over there. She's never short of ideas about how to proceed. If we can work together, we need to find some ways to just simply, honestly, get a bigger pot of money for some of these programs.
You're absolutely right, Chairman Cole. We've talked about this, and to get health care over would be the answer. Would get to the non-discretionary side of the budget.
Which then would
Certainly
free
we
up-
can work together with your jurisdiction.
Yeah, if we can do
Absolutely.
some things, I'm just trying to figure out how to align this stuff in a way that would put greater resources available that we could draw from these very legitimate needs. I mean, when you cite your statistics of, lifespans that are 4.5 years less, and in some cases, I guess Montana, if I remember correctly, 20 years less between white men and Native American men. Those are pretty stunning indictments of how we've operated over many, many decades. So it has to change, and I know we're trying. I know this committee really, in a very bipartisan way, is trying. So with that, I just wanted to get those on the record just as things to think about and to invite those of you that are testifying here today or those of you in the audience that hold significant positions in tribal governments and various national tribal advocacy groups to kind of help us think through what kind of framework we could approach it, because I think we're stuck with a $31 billion allocation or whatever. There's just no way to rapidly make
If we're
any
lucky.
kind of progress. If we're lucky.
Yeah.
If we're lucky. I'm sorry, more than I meant to say, but I'll yield back and be more quiet the rest of the day. But I wanted to get those things out.
We're always happy to hear from you. Okay, with that, thanks to you and to this panel, and we appreciate your attendance. Next, our second panel. If you'll come on up. National Council of Urban Indian Health, the Indian Health Center of Santa Clara Valley, Riverside, San Bernardino County Health, Indian Health, and the California Rural Indian Health Board. So some folks from back home. That's good. Hi, how you doing? Good. Good to see you. Welcome. And we appreciate you being here, and we'll start right away. Ashley Tuwami, National, is that close?
Close.
Close, okay. That counts in government work.
Yep.
National Council of Urban Indian Health. You're recognized for 5 minutes.
Thank you. My name is Ashley Tuomi. I am an enrolled member of the Confederated Tribes of Grand Ronde of Oregon, the CEO of American Indian Health and Family Services of Southeast Michigan, and the president of the National Council of Urban Indian Health, or NCUI. On behalf of the 43 clinics and programs located in 22 states, one you'll hear from in a few minutes, another one later today, I am grateful for this opportunity to once again testify before you guys today. NCUI represents culturally competent, quality healthcare clinics in urban environments across the country. Currently, over 70% of American Indians and Alaska Natives live in these areas, often because of the federal government's relocation policy or lack of economic opportunity. Before I ask for additional funding for fiscal year 18, I must convey our profound appreciation for the funding increase for urban Indian health care, which was included in the fiscal year 17 bill, thanks to this subcommittee's strong leadership. However, as you know, even with that increase, IHS is still significantly under-resourced and usually funded at between 50 and 60% of need. While healthcare spending per capita across the nation was more than $9,990 in 2016, IHS spending on healthcare per user was just $2,834. As you know, federal prison per capita spending is higher than that of Indian Health Services. Even with the much appreciated fiscal year 17 increase, IHS spends little more than 1% of its budget on the provision of healthcare to urban Indians. In addition, IHS's Office of Urban Indian Healthcare Programs acquired 7 new National Institute for Alcohol Addiction programs over the past year, bringing the number of programs and clinics from 36 to 43 with a minimum budget to work with. Unlike IHS and tribal facilities, urban Indian programs can only draw from one line item for funding, the urban Indian line item. Taking money from tribes who are also underfunded is not the answer, as Indian healthcare as a whole is in need of more funding. Increasing the overall IHS funding and increasing the urban line item is the solution. Last year, I discussed the need for urban clinics to receive 100% federal medical assistance percentage, or FMAP. Urban Indian health programs were coming into existence when the Social Security Act was amended in 1976 to include IHS and tribes. But that should not exclude urban programs, considering they are providing the same services and care as IHS and tribes provide to Indians living on reservations. The federal government's trust responsibility extends beyond reservation borders, and failure to provide urban Indian health programs with 100% FMAP harms clinics and programs. Fulfilling this 100% FMAP would reaffirm trust responsibility, as well as encouraging states that may feel compelled to restrict Medicaid eligibility. The cost to do this, according to IHS, would be minimal at approximately $2.3 million per year. One of the great programs that has helped tremendously is the Special Diabetes Program for Indians. Grants made to help this program have seen a reduction in diabetes cases as well as subsequent health care cost. This program expires on September 30th, and due to its success, we would like to see it renewed. SDPI supports over 330 diabetes education, treatment, and prevention programs in 35 states. The failure to reauthorize this program would severely undermine the promising progress UIHPs have made against diabetes. American Indians and Alaska Natives are 1.6 times at higher risk of diabetes than the general population. And over the past 11 years, this program has helped to reduce end-stage renal disease by 43%. End-stage renal disease is a major driver of healthcare cost, and this program will help to offset costs not only in IHS, but in Medicaid and Medicare as well. IHS and tribal providers, as well as other comparable federal health centers, are covered by Federal Tort Claim Act. However, urban programs were left out and must purchase their own malpractice insurance, which is costly. Two large, highly regarded UIHPs in Oklahoma, which are represented by NUCUI, each pay $250,000 per year for malpractice insurance. And while this may seem unrelated to this subcommittee, it would allow programs and clinics to focus their funding on helping patients and resources. Finally, we would ask that a memorandum of understanding between Indian Health Services and the Department of Veteran Affairs be fully implemented. They have this agreement with tribes, but not with urbans. Many American Indian and Alaska Native vets prefer using urban Indian health programs because of accessibility and cultural reasons. There are also times when the VAs experience high traffic, and urban Indian programs can reduce this workload. After this sacrifice for this country, it's our responsibility to make sure that all of our vets are taken care of. I appreciate the support that the subcommittee expressed last year on the MOU when I testified, and I regret to report that our efforts to work with the agencies involved have not been successful, and that is why I'm back again this year asking for your help. Thank you for your time today.
Next, Sonia Tananowski, CEO of the Indian Health Center of Santa Clara Valley. You're recognized.
Good morning, Ranking Member McCollum and subcommittee members. My name is Sonia Tutnowski. I'm the Chief Executive Officer for the Indian Health Center of Santa Clara Valley, an urban Indian health program in San Jose, California. I'm an enrolled member of the Makah Tribe of Washington State. I would first like to thank the subcommittee for holding tribal witness hearing days. In addition, IHC has received an IHS contract, which does not allow for us to get as many resources as we need to run our facility. As a 330 federally qualified health center, we are certified by the AAAHC for ambulatory health care and by the National Committee of Quality Assurance as a recognized patient-centered medical home. We provide medical, dental health, mental health, traditional, and community services to our over 22,000 clients throughout Santa Clara County, where there are more than 26,000 American Indian and Alaska Natives. Of our clients, 89% are served by Medicaid, and 43% of our Medicaid clients are under the age of 18. Of all the patients served by the IHC, 73% are under the poverty line. Urban Indians are 3 times more likely to be homeless than non-Indians, and we do our best to address these social determinants of health in our healthcare setting. But if 100% FMAP eligibility was expanded to include urban Indian health programs, all IHC eligible AIANs would be able to access the federal trust responsibility throughout the ITU system of care, making ITU system of care whole. Medicaid has given us the opportunity to serve our urban AIN community, but our capacity and infrastructure are in dire need of investment and to accommodate this need. We have been able to leverage our current resources to continue the work with a measured return on investment. Every change in funding, reduction in program, or change in funding methodology has direct impact on patient care. I would like to extend my appreciation for the UIHP assessment, which increases understanding of our community's needs. We seek the committee's consideration for follow-up measures to this assessment, including funding formularies and clear spending protocols to promote transparency and accountability, measurable technical assistance so that the UIHPs can maximize billing potential, leverage resources, and continue to manage and monitor progress of our patients served. Given the robust programs we have been able to develop as a 330, we could not continue to operate only on IHS funding. I would like to voice my support for legislation like H.R. 292, reintroduced by Congressman Young and Ruiz, which would exempt programs serving AIAN from sequestration. Decades of unfulfilled federal obligations have devastated tribal communities who continue to face persistent shortfalls and overwhelming unmet need. Federal support remains critical to ensuring the delivery of essential healthcare services both on and off reservation land. As this committee is aware, relocation played significant role in the health and well-being of the 723,000 American Indians and Alaska Natives in California, with a large number of them being or descendants of those who were impacted by the Indian Relocation Act of 1956. The impacts that this are still far-reaching, as San Jose was assigned relocation center, and just in the IHS facility alone, we have identified 114 different tribes served. Urban Indians not only share the same health problems as the general Indian population, their health problems are exacerbated in terms of mental and physical hardship because of the lack of family and traditional cultural environments. In many cases, like mine, the Urban Indian Health Program is the only American Indian program in the county. We have recognized that for the Urban Indian Health youth that are at greater risk of serious mental health, substance abuse problems, suicide, increased gang activity, teen pregnancy, abuse, and neglect. The IHC has worked diligently to address these ever-growing needs, but we need steady support and continued funding to plan for the seventh generation. We have developed a youth-guided, family-driven approach to mental health and wellness. We believe healthy individuals make up healthy communities, but it is the responsibility to find ways to bring the support to the community. Culturally competent care depends on us. I would like to voice my support for Senator Cole's Indian Healthcare Improvement Act Bill, H.R. 1369, which confirms the federal government's duty to all AIAN people, making permanent the Urban Indian Health Program and recognizing AIANs can be served where they reside. We ask that while you consider appropriations for FY 2018, consider a $10 million increase for the ITU system of care with a formulary that takes into account the entire AIAN population and steps to create network capacity and infrastructure to meet the health needs wherever they are. As long as you don't do this by divesting tribal monies, but by increasing the abilities of tribes and Indian healthcare providers to reach the AIN community where they are, rather than forcing them into a already strained system who also does not have enough to serve the people they already have in the system. So your support will help make the federal trust responsibility whole and move us closer to a seamless ITU system of care, where IHS-eligible AIAN can access primary care, behavioral health, and specialty care networks within the four walls or beyond through 1115 and 1915B waivers. The U in the ITU system of care needs your support to ensure that the system remains strong and the investment in the system can withstand any scrutiny. As the chair of the California Consortium of Urban Indian Health Centers, representing 10 UIHOs in California, providing health services to 78,000 patients, we ask that you increase the Title V Urban Indian line items so that it can support the patients and continue the continuity of care we have already established with our patients and reach those who have not had the opportunity to receive those services yet. Together, we can stabilize the ITU system of care by increasing the funding, increasing Urban's opportunities throughout legislation, and to help you meet the requirements of Public Law 94, 437, Title V by providing culturally competent care to every American Indian and Alaska Native. Thank you for your time today.
Thank you. Thank you for your testimony. Next, Mark Jensen, CEO of the Riverside San Bernardino Indian Health Service. Welcome.
Thank you and good morning, everyone. I am Mark. Sorry.
Oh, you got it?
This needs to be read, sorry.
Here we go. Good morning, everybody. I am Mark Jensen. I am the Chief Financial Officer for Riverside San Bernardino County Indian Health. We're located in Southern California. I am substituting today for Teresa Sanchez, our board president, who had a family emergency and could not be here to testify. We are thankful for the support of Congress and the funding provided to improve the health status of our people. This is why I was appointed by our consortium tribes to bring to your attention a tactic that has been recently used by the IHS to stagnate growth in our budgets. Excuse me.
Some water?
Thank you, that'd be great. Starting in 2014 and continuing into 2015, 16, and 17, the IHS has been redirecting new annual congressional monies from the recurring category to the non-recurring category. The IHS indicates it has been doing this to ensure that 100% of contract support costs is funded. But starting in 2016, contract support costs have their own appropriation line. Yet this damaging practice continued on needlessly into 2016 and now into 2017. The negative effect on Indian health programs across the country is that our budgets are not growing from year to year as they have been in previous years. The result is flat budgets that do not keep pace with inflation. It is beginning to take a terrible toll. For our program, budgets have only grown 2.3% over the past 4 years. Meanwhile, the IHS national budget has been funded by Congress at a much higher rate. The bottom line is the new monies are not trickling down to where it is needed most, and that's the tribal health care programs. And IHS can now more easily manipulate these new monies by keeping it for themselves to fund their own special projects. These new monies provided by Congress every year need to be recurring monies to help us keep up with the cost of inflation and patient growth demands. A second area of growing concern is purchase and referred care funding, formerly known as contract health services. The California tribes are much different than tribes in the other 49 states. The reason is that we don't have available to us hospitals and specialty services such as cardiologists and neurologists. Because of the lack of these expensive medical services, the California tribes have to go out into the community and hire these hospital and specialty services, and it gets really expensive. We have asked the IHS to take these factors into their calculation so as to make it more fair to the California tribes. The IHS has attempted a weak response to our strong needs by placing a no access to hospitals factor in Tier 3 of their Tier 3 system. And according to their own tier system, Tiers 1 and 2 get funded every year. But in most years, there is not enough purchase and referred care monies to make it to Tier 3. The result is the California tribes fall further behind the rest of the tribes in the country. In conclusion, I am authorized by my consortium tribes to ask this committee to instruct IHS to do two things. First, direct IHS to restore funding from the non-recurring category to the recurring category. starting with fiscal year 2014 and moving perpetually forward. Recurring monies grow the budgets, and this is the method IHS has used historically to grow the tribal budgets. They need to get back to that method. Second, direct IHS to move the no access to hospitals factor from Tier 3 into Tier 2 so as to ensure that California tribes get a fair increase every year. 2 GAO reports have also recommended similar changes to make the formula more equitable. I thank you for your time and consideration.
Thank you. Thank you for your testimony. Next, Lisa Elgren, Board Chairwoman of the California Rural Indian Health Board. Welcome. You're recognized.
Good morning, Chairman and committee members. My name is Lisa Elgin, and I am the Board Chair for the California Rural Indian Health Board, known as CRIB. Thank you for giving CRIB the opportunity to testify about funding of the IHS. As authorized by the Indian Self-Determination Education and Assistance Act, CRIB is authorized to provide services to Public Law 93-638 contracted tribal health programs. CRIB was founded in 1969 to bring federally funded health services back to tribal communities in California. These services were withdrawn as a result of federal termination practices that began in the 50s. As a result, these practices, many American Indians in rural areas had no access to medical or dental services, and child and maternal mortality rates were abysmal. Since CRIB was founded, California tribes have built a network of 32 tribal health programs and have served more than 80,000 patients who are eligible for IHS services. While our health has improved, our population is growing, and we still face some of the worst health inequities of underserved population in the U.S. Here are our requests. First, we respectfully request that the committee fully fund the IHS and ensure that California IHS area receives equitable funding regardless of overall funding level received by IHS. It is evident from numerous GAO reports and current funding levels that California does not receive equitable funding despite having more American Indian and Alaska Natives and more federally recognized tribes than any other state. During the last several years, bipartisan collaboration between Congress and the administration has resulted in a noticeable overall increase for the IHS budget since fiscal year 2008. Year after year, the federal government has failed by drastically underfunding IHS far below the demonstrated level in need. The treaties entered into between the tribes and government established a responsibility for the federal government to provide health care to tribes and American Indian and Alaska Natives. The federal government has a legal, moral, and trust responsibility to uphold its part of the treaties and provide these services to serve our diverse population. We request full funding of the IHS at $30.8 billion, phased in over 12 years. This is the amount calculated by tribal leaders on the National Tribal Budget Formulation Work Group of IHS, representing all 12 IHS areas, to develop the National IHS Budget recommendations for fiscal 2018 budget year. Second, we request the committee to do everything in its power to have all government GAO recommendations related to IHS services acted upon, particularly those recommendations relating to ensuring equitable funding to underfunded areas like California. Third, we ask that the committee increase funding to the IHS facilities M&I program to catch up with the amount of facility space of the IHS facilities inventory, including the California IHS area. We respectfully request that the committee fund the IHS facilities M&I funding in the amount of $105 million. In California, this funding is critically important because despite many years of trying and more than 50 applications, no tribal health clinic or hospital facility has ever made it to the IHS facility construction priority list, nor joint venture program. As a result, tribes in California have cobbled together funding and taken out loans in order to build facilities for our growing population. This funding, if increased, would go a long way to help maintain our facilities. Fourth, we ask that the committee request a GAO report on the IHS facilities construction priority system, which have been substantially revised since 1991. Next, we ask your support for the SDPI program. This authorization ends September 30, 2017, so swift congressional action is needed for continuity in staffing, medical supplies, prevention, and education services. Next, we ask that you support the American Indian and Alaska Native mental health substance abuse programs by fully funding the methamphetamine suicide prevention initiative and domestic violence prevention initiative. These programs are currently funded through a competitive grant process that creates barriers to care and requires tribal programs to fight against each other for critical funding. We also thank you for your continued support of the California Indian Youth Regional Treatment Programs. Your support will assist the youth to strengthen communities. We also ask that you require IHS to develop a new method to purchase preferred funds to account for variations across IHS areas. We've testified before on this, and we're still asking for fundings for actual need. In conclusion, on behalf of California Rural Indian Health, I ask that IHS appropriations be increased to fully fund its services and programs over the next 12 years, and that you hold the IHS accountable for inequities in its funding distribution because it continues to impede our efforts to provide level of care to our area. Thank you.
Thank you. Thank you for your testimony. Thank you for all your testimony. Mr. Jensen, your testimony regarding non-recurring to recurring, we'll look into that, find out what is going on. And on this IHS construction, I know the infrastructure throughout Indian country, throughout the United States, is woefully behind. And so just like Indian schools, we have a big challenge ahead of us. And I'm going to take up Mr. Cole on his offer to work together to see if we can get some additional dollars, any way we can get it, to take care of some of these challenges. So I appreciate your testimony. With that, Ms. McCollum.
Mr. Chair, I concur with the remarks that you made, and to add on to it, this programming and seamless transition between veterans, Indian Health Services, and getting services where and as needed is something that I know when I was on the Veterans Affairs Committee that we talked about, we've discussed here, and I think we need to have the staff figure out if we need to put report language in the VA bill as well as in our bill to just get it done, because we know with working, a couple of us are on DOD and watch them struggle with healthcare records between the VA, so sometimes stronger medicine, to use maybe a bad phrase, is needed to get things moving. So the diabetes funding has come up a couple of times, and I'm sure it'll come up again. And if my memory serves me correct, Mr. Cole, that's a combination of some different funding. There's funding for the diabetes programs in Indian Health Service, and there's funding in the CDC, and there's funding in the Affordable Care Act. And to your point earlier, a lot of, it takes a pretty astute accountant, both in Indian education and Indian health, as well as Indian tribal accounts, to take all these different streams of money and figure out how they make things whole. But as we look forward, working to, I think, reauthorize and keep this moving forward, 8-point reduction in diabetes is something to celebrate. And I wanted to make sure I had the number right, so I took a look at it. It is something that we need to keep working towards. And as cuts are made, we have to make sure that we're not funding what we can here, and then there's a cut made some other place that throws everything out of balance. So, Mr. Cole, I think we've got our homework cut out for us on the Indian diabetes special project funding.
Mr. Cole, recognized.
Very, very quickly, Mr. Chairman, I think I hope we do look at some of these places. These urban Indian healthcare centers are doing an amazing job, and that's where a lot of our population is. I was over the break actually went to the new facility that in Oklahoma City at the Oklahoma City Indian. It was quite stunning, but they'd done it by raising their money themselves. I mean, basically, they had a capital campaign, and we've got a much better facility. It's being more used, but again, we're not up to speed. I wonder if we could urge again on these diabetes program, the appropriate committees of jurisdiction, which I assume is Energy and Commerce, to to do their job. I mean, they need to reauthorize this program, and I wonder if we could also urge again in our report language, this Indian health centers, urban health centers, having to pay malpractice insurance when nobody else does, in the federal system is unbelievable. And again, that's a lot of money out of pocket, and your point was extremely well made. That ought to be going. That's a function the federal government ought to be paying themselves. Those individual clinics shouldn't be having to do that. So, yeah, particularly when, again, IHS facilities nobody else does it. It's just them. And that's something that we need to look at.
Especially if they take the claims out of the judgment account, not out of our budget.
Absolutely.
Yeah. Okay, well, thank you very much. I appreciate your testimony, and we'll move on to the next panel. Thank you. Next, the Cherokee Nation, the Muskogee McCreek Nation, and the Osage Minerals Council. Osage. Okay, that's why you have Tom here to keep me straight. Yeah. I got Cherokee right.
Well,
that's right. Everybody have a seat. Okay, we thank you for coming out this morning. So first, we'll recognize Bill John Baker, the Principal Chief of the Cherokee Nation. Welcome.
Chairman Calvert, Ranking Member McCollum, and distinguished members of this subcommittee. OCO. I am Bill John Baker, Principal Chief of the Cherokee Nation, our country's largest Native American tribe. I appreciate the opportunity to testify before you this morning. We are more than 350,000 tribal citizens and have long been a driving force in the economy of our state. We employ over 11,000 people and support 18,000 jobs. Our economic impact on northeastern Oklahoma for 2016 alone exceeds over $2 billion. We are a stabilizing force in our region. Early this year, we broke ground on a $200 million 470,000 square foot health center. And in 2019, this facility will be the largest health center in Indian country. I want to thank this subcommittee who had such a large role in making this possible and opening up the joint venture for IHS. The Cherokee Nation is making a difference for our citizens and for Oklahoma. And this is why we propose funding cuts in the President's fiscal year 18 budget concern me. The blueprint calls for an 18% cut to the Department of Health and Human Services. Such drastic cuts to IHS would have a lasting impact on our healthcare system. Jobs would be lost, patient wait times would increase. We estimate that nearly 92,000 patients would go unseen, putting their health and lives at risk. The blueprint also calls for a 12% cut to the Department of Interior. This cut to Interior would be unfair to Cherokee students. At least 2,000 would go unserved. The drama, band, and robotics programs at our BIA school we operate would be eliminated. It would lead to the closure of daycare centers, reduced staff and hours at nutrition sites, and the number of citizens that we serve. As you work through the appropriations process, I urge you to reject any cuts to IHS, BIA, BIE, and other tribal accounts. I applaud the subcommittee for highlighting BIE school construction and repair in recent years. Last year, I called for the establishment of a BIE program equivalent to the IHS joint venture program. I repeat that request today. Sequoia High School requires immediate assistance. Because of the great cost to replace these aging facilities, it is unlikely we will receive BIE funding. We need a solution. If given the opportunity to assume school construction and repairs in exchange for fixed operating and maintenance costs, we could alleviate some of the massive backlog. We must embrace innovative solutions to school construction. I'd also like to update you on an issue I raised 2 years ago. We continue to have a stalemate with Interior and the Interior Business Center over their shift in policy regarding cost related to tribal enrollment activities and calculating our indirect cost rate. This issue has caused a serious delay in determining our indirect cost rate for fiscal year 17. House Appropriations Committee included language on this matter in fiscal year 16. The language directed Interior to report to the subcommittee on its justification for this change and how it would apply to tribal enrollment activities. Your directive has been ignored. Our discussions are moving in the wrong direction. Verifying tribal citizenship and preventing fraud is crucial to eligibility for many of the federal programs we administer. For decades, these costs have been allowed. We ask for your assistance to ensure that the long-lasting policies which properly allowed such costs to remain in effect. Finally, we continue to support full funding for IHS and BIA contract support costs, and thank the subcommittee for its work to fully fund contract support costs without jeopardizing program funding. Failure to fund these costs impedes our ability to meet the needs of Cherokees. We respectfully urge the subcommittee to continue employing a separate and indefinite appropriation. Thank you for granting me this opportunity today.
Thank you, Chief. Thank you for your testimony. Next, James R. Floyd, Principal Chief, Muskogee Creek Nation. Sorry, Tom. You're recognized for 5 minutes.
Thank you, Chairman Calvert, and good morning, everyone. Congressman McCollum, good to see you again. It's Muskogee Creek Nation. I'm James Floyd, Principal Chief, and I'm speaking today on behalf of more than 82,000 members of the Muskogee Creek Nation, neighboring tribe to the Cherokee Nation, and I support many of the points that were brought out in previous testimony. I'd like to begin my remarks this morning to, first of all, talk about the need for regular order in the budget process. As we go into fiscal year 2018, we need to make sure that that Congress does follow the regular order process in getting appropriation bills enacted. We've worked since 2015 with continuing resolutions, and it's time to make that change.
With you, brother.
So, along with that, I think it's time that we again talk about mandatory funding versus just the discretionary that we've endured since inception. I guess I could put it that way. I know my whole entire career, more than 30 some odd years, we've dealt with discretionary funds, and so having been a senior executive within the Department of Veterans Affairs, I guess I could say I enjoyed the 2-year funding and the advanced funding and the mandatory funding in terms of being an executive and managing healthcare systems for the VA. That was very crucial, and us making sure that we did not have stops in service delivery to our veterans, and I think the same thing should occur with our Indian people. We all know about the treaty and trust obligations, and I think this would fulfill that. I'd be glad to assist in any way possible in doing so, but I think that it's imperative that this year we address that. I would also suggest that we increase funding to expand the joint venture program. Chief Baker talked about that. We presently have a joint venture program in Eufaula, Oklahoma, one of the highest unemployment counties in the state of Oklahoma, exceeding 10%. The difference that makes, we've invested in this particular joint venture $30 million of our funds. We are moving from a 5,000 square foot clinic to a 70,000 square foot clinic. That 5,000 square foot clinic was built in the late 60s. facilities within the Muskogee Creek Nation include 3 state licensed hospitals and 6 outpatient clinics. The average age of our facilities are 40 years old. And so they all need replacing. We have 2 right now that need to be placed in the joint venture program. And so I think expanding that provides that we can continue to keep up with adequate facilities for the safety of the staff, for the provision of care, and improvement of quality to our patients. Most recently, the tribe itself invested $90 million of our own money to rebuild a hospital in Okemah, which was originally built in 1948. We're just now going to be opening that in October, so you can see that model of kind of desperation funding of these facilities is just not the way to go. So I think the expansion of the joint venture program would go a long way toward systematically replacing aging facilities and have quality facilities that we need. And so strongly support that. We also request increase in funding for hospitals and clinics as we go into 2018. Thank you, sir. And we understand, we haven't clearly seen all of the proposed reductions, but expect that to be 12 to 18%. And, having endured continuing resolutions for previous years, that in itself brought cuts to the program, so we don't really want to see proposed further cuts that would just continue to reduce the services that we provide. And so we ask that you fully fund, hospitals and clinics line items so we can provide those basic services that our patients need. I'd also like to speak about the self-governance program and just talk about that, that we do 2 things. One, expand that to other services and programs within the Department of Health and Human Services. There are programs in the Health and Human Services Department that go through states and are offered to the tribe in terms of grants that really needs to be looked at in terms of those being able to be compacted from the Department of Health and Human Services directly to the tribes. And finally, I just wanted to talk about real estate trust services and say that we need to continue to look at that and continue to move forward with fee to trust processes, sir. Thank you very much for your time this morning.
Thank you. Thank you. Thank you for your testimony. Next, Cynthia Boone, council member of the Osage Minerals Council.
Good morning, Mr. Chairman and members of the subcommittee. My name is Cynthia Boone. I am a member. Good morning, Mr. Chairman and members of the subcommittee. My name is Cynthia Boone. I am a member of the Osage Minerals Council. The Osage Minerals Council has 8 members. Thank you for the opportunity to testify. Our Osage Reservation is unique in all of Indian Country. First, the Osage purchased our 1.5 million acre reservation in 1883 for about $1 million. Second, the Osage Minerals Council, not the Osage Nation, is responsible for developing and protecting the Osage Minerals Estate. The Osage Minerals Council was given this opportunity under a 1906 Act of Congress and the Osage Nation Constitution. Development of oil on our reservation goes all the way back to the 1890s, more than 100 years ago, and before the allotment of our reservation in 1906. As you know, under allotment, Congress divided up Indian lands and provided small parcels to individual members of the tribe. In our case, Congress allotted the surface lands, but not the minerals. Congress reserved our entire minerals estate for the benefit of all members on the tribal rolls at that time. Congress called our members on the rolls at that time head right owners. Each head right owner had 1 share of royalties from the production of oil and gas in the Osage Minerals Estate. Today, many of those head right interests are fractionated. The Osage Minerals Estate has been producing oil since 1896, making it one of the oldest fields in the United States. Our minerals estate still contains proven reserves. In 2015, it was estimated that head right owners would receive about $13.6 billion in royalties from 2012 to 2017. That's about $1 billion a year. Despite our success, the Osage Minerals Council faces many of the same challenges as other energy-producing tribes. We also face some challenges that are unique to the Osage. First, like other tribes, energy production on our lands is limited by a lack of staff, expertise, and resources in the Bureau of Indian Affairs agency offices. Without the BIA staff or expertise to keep up with the energy industry, we are not able to fully develop our resources to benefit the Osage head right owners. For example, we estimate that the BIA averages more than a year just to approve a single workover permit. A workover permit only approves maintenance for an existing oil and gas well. You can imagine the delays for permitting a brand-new well. BIA needs far more than the $5 million or so budgeted in the past to manage our oil and gas development across Indian country. BIA needs 10 times that amount. When you compare the BIA's budget to the $187 million budget that the BLM budget has for oil and gas development on federal lands, it's no wonder that the Government Accountability Office recently determined that the BIA management hinders Indian energy development and needs sweeping changes. Second, unlike other tribes, the 1906 Allotment Act creates special legal requirements for leasing on our lands. For example, leasing on the Osage Minerals Estate is specifically excluded from the Indian Mineral Leasing Act. Instead, the Interior follows Osage-specific regulations, and the BIA is the only agency involved in approving our oil and gas permits in our minerals estate. The BIA does not get any help from BLM or the Office of Natural Resources Revenue like other Indian reservations. The Osage Minerals Council also has unique management responsibilities, but our funding is limited as well. We currently manage the estate with an annual drawdown from royalties that should be distributed to the Osage headright owners. This is an unfair burden on our headright owners and is not enough funding for effective management of the estate. Meanwhile, every year since 1921, the state of Oklahoma has collected a 5% gross production tax from our royalties. In many years, the tax generated is in excess of $5 million for the state, but provides no benefits to the Osage Nation. With this impact from state taxes and many responsibilities for managing the Osage Minerals Estate, we respectfully request that the subcommittee provide direct funding to the Osage Minerals Council to help us hire the staff we need to manage the estate and promote drilling and production. As highlighted in our written testimony, we need about $2 million in funding to employ experienced staff, create a digital database to monitor well production and environmental hazards, and about $5 million in funding is needed to plug abandoned wells. Just as an example, BIA found roughly 1,400 wells for plugging. Each of these wells costs between $10,000 to over $100,000 to properly plug and abandon. These are old, open wells, and they are a hazard to all. Even worse, the BIA has not complied with environmental review requirements for years. This subjects the United States and the Osage Minerals Council and Osage leases to never-ending litigation and kills development of new wells. We need to turn this situation around. Oil and gas production in the Osage Minerals Estate supports thousands of jobs and provides badly needed economic development. We respectfully request that you increase the BIA's national energy budget, and we request $4 million in direct funding for the Osage Minerals Council so that we can bring management of the Osage Minerals Estate into the 21st century. Thank you for the opportunity to testify, and I'm available to answer any questions.
Thank you. Thank you for your testimony. I appreciate that. Chief Baker, your testimony, obviously, you struck a chord when you talked about the 2018 budget. You're not the only one that's worried about it. I think that you'll find a choir to sing to around here, but we're all anxious to see what the budget looks like when it comes around on May 22nd, I guess, is the magic date. So we'll see what happens. But we'll need all of your help, I suspect, when that occurs. And certainly we'll take a look at this issue with indirect cost rate and find out why our directive was ignored. That's not a good thing. So I'll certainly follow up on that. And as far as the mandatory spending side, we were talking about that earlier today, Chief Floyd, and so Chairman Cole and I will be working on that together with his committee, and I hope we can come to some kind of solution to that problem. And energy production in the United States is important. We'll certainly look at that, and we have challenges not just in Indian country, but throughout the United States as far as getting these permits done in an orderly fashion.
Thank you.
But with that, Ms. McCullum, recognized.
Thank you, Mr. Chair. Once again, I think you kind of summarized some of the issues really well. Ms. Boone, one of the challenges that we were hearing back several years ago when we were doing public witnesses that people were being hired out of the Bureau to work in the private sector because they could make so much more money. And so that was creating this ever cycle spin down in staff shortage. And I know things have changed a little bit in the market, but it sounds like the staffing levels haven't improved, so I know we'll take a close look at that. And then, gentlemen, in both of your testimony kind of reflects on some of the earlier testimony on tribal colleges and students attending tribal college with how there's a huge gap in what those students have for whether it's tuition dollars, boarding dollars, and it's really making the cost of college a real struggle. And I've had the opportunity to speak to students not only from Minnesota working on their advanced education after finishing high school, but from around the country. And this country can't afford to leave anybody behind who wants to, enter the workforce and be part of the future of this country. So we need to, I want to understand some of this funding gap better because they get hit in a couple of different ways beyond what rather other college students do. And quite often these young adults are young parents too, trying to kind of balance work life and work home. So I'm picking this up more as a theme this year in all the testimonies. So I thank you both for bringing that forward.
Cool.
Thank you very much, and I want to begin by pointing out that Chief Baker was much too diplomatic to point out that this hospital he's building that will become the largest Native American build is surpassing the Chickasaw Hospital. So but, I have to say this is a great program, and our tribes have really used these, I think, exceptionally well. And frankly, it's a great boon to all of Indian country because this is our money going in to build IHS, or build facilities we're operating basically. But it takes a burden off the federal government and puts it on a tribe, and that frankly then frees up other money to go to tribes that are not as fortunate, quite frankly, in terms of being able to afford the cost of facilities. So it's a big win for the federal taxpayer for sure, and for Indian country, and it's a program we ought to continue to fund. But these tribes are to really be commended because they're taking an enormous responsibility upon themselves and using their own resources in ways that, again, help those that are a lot less fortunate. I, too, want to just echo my concerns about the budget cut proposals, but also suggest that we look at our own budget committee, because that's where those decisions are going to ultimately be made. I mean, the president's proposal is just that. It's a proposal. What I'm most worried about, and I sit on that committee, and the tendency will be the president wants to do some things that I agree with very much. I mean, we've not adequately funded defense. He wants to increase that. I think that's a necessary thing to do. But if you want to offset the cost, I understand that, but you need to look over the entire budget, not just focus on the non-defense discretionary. And I'm afraid that's what we'll do. And if we basically adopt administration proposals on defense without raising, and my friend here will know exactly what this is, the 302A, which is the total discretionary spending line, then these cuts will come, and they won't come in exactly the manner forecast. But if all of a sudden my friend the chairman's allocation falls dramatically, he's going to have to do the best he can. So it's what Congress does on the budget, honestly, more than what the president proposes. That's really the key. And we're having those debates and discussions. I don't think that budget will be out until June. So I think making the points in May when the president's budget comes out are important. Now, again, to be fair, particularly in the area of Indian health, the chairman and I both visited with Secretary Price about this is not one of the areas that ought to be suffering these kind of cuts, and the administration in its own budget said this would be a priority item. It didn't tell Indian Healthcare Service, didn't tell us exactly what that meant, and I suppose we'll have a fuller disclosure, but those are things that, an already underfunded system just can't afford. I mean, there's no way we could have cuts of that magnitude without seeing dramatic impact in Indian country and health outcomes as well. So I appreciate all of you highlighting that. And this mineral issue, as Ms. Boone knows, is particularly knotty in Osage country. It's difficult for Utes. It's difficult for the 3 affiliated tribes. But this unique relationship that they have with the BIA really does hamper the funding issues, even beyond what we see, in the other areas, because it's just BLM just has a lot larger budget, and we ought to look and see if there's some way, and it would probably require legislative action too, to at least make those resources available in Osage country as well. I mean, this is one of those leftover type situations. We have so many which in Indian country that are due to very unique historical circumstances. And it's been a very mixed blessing for the Osage, to say the least, as my friend would know. But it's something that ought to be able to be solved. They ought to have access to a larger pool of money. And I don't know why the BLM, shouldn't be their resources at least available for some of these kind of issues, because these are all, as Ms. Boone pointed out, these are old fields. And we are making it so hard to drill. These don't produce a lot of oil. Most of these are stripper wells, under 10 barrels, a lot of them under 5, and some of them 1 and 2, literally. So when it's taking a year to get a permit to rework a well that's only producing
Why
a
doesn't
feed,
the BIA just contract that out to the BLM, since they're more apt to
that's
doing
something
that?
we ought to explore.
Because they're more apt to do that, probably be more logical for them to
But there needs to be some way. Again, there's a unique, the Osage situation is very unique in Indian country. But there's got to be a better way to administer this thing than what we're doing now.
Sure.
So anyway, yield back.
Thank you. Thank you, and thank you all for your testimony. We appreciate you being here today. Next up is Valerie Walters, Executive Officer and Trustee of the Chickasaw Nation. I got that one right.
Yeah, you got that.
Oklahoma Humanities Council. Jennifer L. Johnson, PhD student, University of Oklahoma. Spoken Creek Documentation Project. Okay. Good morning. Great, thanks for coming. So without any further ado, I'm going to recognize Valerie Walters with the Chickasaw Nation. Welcome.
Good morning, Mr. Chairman. Good morning, Mr. Chairman and members of the subcommittee. Thank you all so much for allowing me to testify today. I'm here to talk with you about the Oklahoma Humanities Council and also how they help tell the Native story, as well as those across the U.S. The programs within the humanities cover all areas from history, philosophy, literature, and ethics, and the programs themselves include everything from museum exhibits to literature sessions to films. In these stories or in these programs, we are able to share the importance of the Native American history all across the United States, which, as we all know, is very important to all of us as Americans. Our audience for the Oklahoma Humanities include everyone. We truly believe that the Humanities Council, or that the humanities, is something for everyone of all ages, all races, all income levels. It's really for everyone. I want to talk to you a little bit about some of the programs that happen in Oklahoma. We have supported Symposiums of the American Indian, which is a week-long symposium at the Northeastern State University, where tribal members and humanities scholars share their knowledge of American Indian contributions in art, literature, and sustaining traditional culture. Along with that, we've also helped in An Everlasting Fire, the Seminoles of Oklahoma, where we actually help support them in redesigning their gallery through artwork, photos, audio, and video recordings. Throughout the state, we actually help with also festivals that take place. One is the Sauk Language Department of the Sac and Fox Nation, where we supported them as they put on an Algonquin Cultural and Language Festival and brought together tribes and different organizations to help celebrate their history and culture. We've helped with the Cherokee National Historical Society's Heritage Center Outreach Educational Program. And this is a cross-cultural teaching where they've spanned over 14 counties and actually reached 15,000 people in sharing their history, their culture, their art, everything for the Cherokee people. We work with the Metro Caddo Cultural Club in Norman, Oklahoma, where they've received several grants in participating their Caddo culture, celebrating that through traditional dances and demonstrations of foodways. Now, this also actually leads into a bigger discussion about diabetes and the impact that is on Native Americans. In Oklahoma, we've also worked for different films or producing different films. We work with curriculum to profile Native Oklahoma women. We've worked with the National Cowboy and Western Heritage Center to help fund a wonderful exhibit, Power and Prestige, Headdresses of the American Plains. So in 2015, when the NEH offered state humanities funding for programs about veterans, Oklahoma partnered with OETA and some tribes to produce a film called Native Oklahoma Vietnam Veterans, and it was a 30-minute documentary that was shared with all Oklahomans. We also, as part of the Chickasaw Nation, have partnered with the Oklahoma Humanities to bring about some funding to help with our literature program called Let's Talk About It, which is a free and open program to folks all across Oklahoma in various public libraries. In other states, whenever we talk about sharing the Native stories, we are talking about various states across the U.S. Alabama, Colorado, South Dakota, Texas focus on Native American traditions in their states. Colorado's Institutes on the Cheyenne and Arapaho tribe were planned with the tribe's input and include tribal presenters. Texas supported the Caddo Traditions Teachers Workshops in a 2-day program, allowing teachers the opportunity to meet with tribal members and scholars. We do all kinds of programs within the humanities. We do films, we do programs for reading. Some of the documentary films, we've done a Native Hawaiian where we featured a 60-minute documentary called Hawaiian Masterpieces, Kuhana Kappa, showcasing the art and techniques of master practitioners used by ancient Hawaiians. Indiana actually produced a film focused on the Fall Creek Massacre and its aftermath. Rhode Island Council for the Humanities funded 2 documentaries, one that explored New England Native identity from the point of view of language preservation and loss, and another one on King Philip's War and its effect on the Native people. Now, as I talked about films, we also do festivals, which include film festivals as well. The festivals funded, the Idaho Humanities Council funded a Native American film series featuring 5 monthly documentary films by Native Americans. The South Dakota Festival of Books annually features a history and tribal writing track with American Indian humanities scholars and authors. Significant tribal voices have included people like Sherman Alexie to help tell the stories. We support exhibits to help tell the Native American story. Throughout, we have councils in Indiana, Massachusetts, Michigan, Texas, and South Carolina who have all funded exhibits that help tell the Native American stories. The Michigan Humanities Council partnered with local groups to bring an interpretive highway exhibit describing the last Potawatomi homestead. In New Jersey, funding from the New Jersey Council from the Humanities enabled the reinstallation of the Newark Museum's Native American collection in a new location. Some of our other programs that help tell the Native story include festivals, history days, curriculum, all ways that we help. So in conclusion, I just want to say, first of all, thank you for your time. We do certainly appreciate everything that you all do, and we truly believe that the humanities helps tell the Native story, and we thank you for all of that.
Thank you. Thank you for your testimony. Next, Jennifer Johnson. You're recognized for 5 minutes.
Mr. Chairman, Ranking Member McCollum, and members of the subcommittee, Stongo. My name is Jennifer Johnson, and I am a citizen of the Seminole Nation of Oklahoma and a PhD student in the College of Education at the University of Oklahoma. I am here today to testify in support of the National Endowment for the Humanities. I grew up in a rural community of Kanawha, Oklahoma. My community is nestled within the tribal boundaries of the Seminole Nation, a tribe with approximately 18,000 citizens located in the south central portion of the state. Although my community is small, it is rich in heritage. Within my family, my grandmother was a monolingual speaker of the Muskogee language. She didn't speak English at all. My aunts and uncles were required to attend boarding schools in which they acquired the English language. The generation that precedes me is bilingual in Muskogee and in English. It is my generation that is not, and it is a loss that I feel deeply today. When my generation was born, we were spoken to in English. Our parents didn't want us to struggle in school as they had. I can still remember my aunt telling me about how she was forced to stand with her nose in the middle of a circle on the wall because she had been caught speaking Muskogee in school. School language policy directly affected my family's use of the Muskogee language, and when my grandmother passed away, I began to hear the language less and less. My testimony today is to highlight the impact of the NEH-supported Spoken Creek Documentation Project, which is an endangered Muskogean language originally spoken in the southeastern United States. It is now spoken by the Seminole and the Muskogee Creek Nations in Oklahoma and the Seminole Tribe of Florida. The project is part of the Documenting Endangered Languages program, which is a partnership between the NEH and the National Science Foundation to develop and advance knowledge concerning indigenous languages and human languages. The project builds on existing collaboration between the College of William and Mary and the Seminole Nation to provide the first documentation of Spoken Creek, or Muskogee as we call it. The goal is to produce 24 hours of audio-visual recordings, transcriptions, and translations into English and train students in language documentation methods. We have been fortunate to include a roundtable of military veterans as participants in the interviews. These veterans served in Bosnia, Korea, Vietnam, and World War II. The stories and life lessons that they have shared through our language is invaluable to the repository of knowledge of American history. We were reminded of the importance of the Muskogee language in service to the United States when in November of 2013, our esteemed elder, the late Mr. Edmund Andrew Harjo, was presented with the Congressional Gold Medal for his service as a code talker in World War II. The Muskogee language was one of a few indigenous languages utilized as military code that could not be broken. Within the Seminole Nation, I estimate there are approximately 200 first language fluent speakers remaining. Unlike other world languages such as Spanish, Italian, or French, the Muskogee language is only spoken in the United States. There is nowhere else in the world that you could travel to hear it spoken in its natural state. According to information from the 2010 U.S. Census, there were only 169 indigenous languages still spoken, and of that number, only 5.4% were spoken across all ages. However, it should be noted that those census figures do not give us a clear picture of what degree of fluency those languages are spoken. With the commencement of the next census in the next 3 years, I expect the numbers of indigenous languages spoken will decrease significantly as the number of first language speakers have passed on. So the work that we are doing today is important as our languages within the United States are unique to the heritage of our country, yet their very existence is fragile. I know that within my lifetime, I will bear witness to seeing the last of our first language speakers go, and this project has provided such vital assistance in not only documenting the Muskogee language, but also providing us with such a concise understanding of American history. The information I've presented is dire, but I can testify to the positive correlations that this NEH-supported project has had within my state. I have seen second language learners who are committed to the revitalization of Muskogee. These learners include a young teacher who goes to work each day teaching classes of Oklahoma high school students the Muskogee language in a local public school. These students didn't achieve their world language requirement by studying our language. School curricula has been developed to include the project videos, and it is through these experiences that I have found hope for our language. This project is one of the many that have been funded by support from the National Endowment for the Humanities. Through its Documenting Endangered Languages program, the endowment has been a leader in providing support to endangered languages around the world, especially indigenous languages and cultures that are unique to this country. Since 2004, NEH has provided nearly $40 million in funding to these efforts. To ensure that programs and projects such as these, vital to the heritage of the United States, I ask you to provide $155 million for the National Endowment for the Humanities for fiscal year 2018. Thank you for the opportunity to speak to you today. Mado.
Thank you, and thank you both for your testimony. You'll find that all support the National Endowment for the Humanities. As a matter of fact, we were able to plus up that budget slightly this year, both the National Endowment for the Arts and National Endowment for the Humanities, and with all of our support, and hopefully we're able to maintain those that support and that funding level. We'll see as this budget year continues. But we're going to need your assistance in that. And I think it's important to point out what this means to Native programs throughout the United States, and the humanities is extremely important as this history may slip us by a little bit, and we need to make sure we maintain that. So I share your concern about that, especially most of the native languages, for instance, in California are gone. So very few of them are left. Ms. McCullum?
Well, thank you, and I think this just goes to show how impactful the humanities and the arts are to each and every one of us, but in particularly of preserving something that's special to each and every one of us, and very special to the different tribal nations in Indian country. And the chairman from Red Lake's going to come up shortly, but we had a very powerful, impactful display at the Minnesota Historical Society on the Sioux Uprising. And watching, as a history teacher, as a person from Minnesota, as a person who works on tribal issues, I live a couple blocks, so I stopped in there quite often. And watching immigrants from the Hmong community and from the Somali community, as well as people who were traveling on vacation, going through and learning of the courage of some of the tribal people who took in settlers who thought their lives were threatened, as well as settlers who took in Native American children from the surrounding community whose parents entrusted them with their care was a story that I had never heard at the Sioux Uprising. And so it's very, very important that we share our history, because that's how we learn about each other and learn not to make mistakes. So thank you. You have so many issues in Indian country, but thank you for coming and reminding us all how important it is to share our stories. Thank you.
Thank you.
Mr. Cole.
Just want to make a couple points. If you're from Oklahoma, we have more endangered languages literally than any place else in the world, and that's actually a federal government statement. But our tribes have really done some remarkable things, and want to first point out that if you guys haven't had a chance to see it, and I actually talked to Governor Anatobi about this, the Choctaws have this amazing program where they have gathered their these are all first language speakers, and they've linked up the public school districts in their with telecommunication thing, and they literally bring classes into the public schools, over 100 different schools in their territory, and you can come in. And I've watched these things in action with lively students, learning the language, and it meets their language requirement, as you suggested. I think even the University of Paris has picked this up. I've never seen a center quite like it. A lot of struggle with different ways to do it, but that way you concentrate people that really are excellent instructors in one site, but you connect them to a territory where there's a broader interest in the language, and a lot of people in danger of losing their language that finally have an opportunity in a public school setting to recapture that. And I'd be remiss not to thank my friend who works with my tribe. Our tribe really has done some remarkable things. I don't know very many other tribes that run their own press. We literally print histories of our tribe and significant figures in it. And someday when we're done competing in film festivals, I'll get you guys a copy of the film of my great aunt Teata, which I guarantee has like Graham Greene in it, from Dances with Wolves. No, it's unbelievable, and you would love her. I mean, she was your kind of person, Betty. But we've done that with first woman aviator, Pearl Scott, who's a very famous figure. So it's amazing how much of this history is being recaptured by tribes when they have the means. Again, that's where the National Endowment of the Humanities is such an enormously important agency, because not every tribe has the means. And so just focusing, this attention on this really has helped us uncover a lot of parts of history that I think the average Americans have forgotten, or frankly, in some cases, have honestly been actively suppressed. But they ought to be remembered. And I commend both of you coming here. Most of the people that come and testify appropriately come and testify here about the BIA or the Indian Health Service, but for each of you to be here testifying for something that literally is beyond just Indian country, obviously, for every American benefits from, just says a lot about both of you and obviously the tribes that you represent. So,
thank you. Thank you both. Okay, have a good day. Next, we'll recognize our next panel. Just the first two. Daryl Secchi, Chairman of the Red Lake Band of Chippewa Indians, and Kevin Dupree, the Fond du Lake Band of Lake Superior Chippewa Indians. Welcome. Thank you for attending, and Mr. Secchi, you're recognized for Secchi, okay, excuse me, Secchi, for 5 minutes. Mr. Chairman.
Abujo, anin ma, na matabik. Sa na besim in the shinikazo, Jabamina Kazohan, Migasin, do them. With your bashing, because I go running it on Jabba, Miminan Mugum, Kian to make, Chipikan Noon, and Nogo, which the Shitamani, Egajuido, Kongati, the Nishinabe, Minaning, when Jabba, Miega Shigish Koyan, Ujabama. Oh, good morning, Chairman Calvert, Ranking Member McCollum, Tom Cole, and all of the good friends of Indian country on this subcommittee. Chimigwich, thank you for listening today. My name is Darrell Secchi, and I'm chairman of the Red Lake Band of Chippewa Indians. Red Lake has over 12,000 enrolled members, half of whom live on 840,000-acre reservation in northern Minnesota. Our tribe, alongside the federal government, is responsible for providing public safety, health services, creating employment and economic development opportunities, and using our natural resources in ways that benefit future generations. Our remote reservation suffers 50% unemployment and lack of basic infrastructure. Our reservation safety net is stretched beyond its breaking point. Year after year of sequestration cuts has made it worse and worse. Sequestration has been a nightmare for tribes like Red Lake, who have limited opportunities for economic development because of our remote location, are unable to raise revenue through taxation, lack access to capital available to other government entities, and are forced to rely on fickle federal funding to provide essential government services. For years, I have served as tribal treasurer at Red Lake, and I know full well our need for federal funding and how painful it is to cut programs. From fiscal year 2013 to 2017, sequestration and rescissions cut Red Lake BIA's annual funding levels by more than $900,000 each year, forcing Red Lake's already underfunded programs to take a big hit. To cover our shortfalls in public safety funding, Red Lake used Tribal Self-Governance Act authority to shift money from other critical BIA programs, cut back on staff, reduce hours for law enforcement and other public safety services. This left our public safety programs understaffed, under-equipped, way below the BIA's own safety standards. Red Lake cannot afford to lose any more BIA funding. Sequestration additionally cut $750,000 each year from IHS funding medical services at Red Lake. This has cost the tribe several medical positions, made patients wait even longer for treatment, delayed patient follow-up care, reduced medical transportation, diminished supply stocks, and delayed replacement of outdated equipment. In my written testimony, I've listed similar cuts to EPA's General Assistance Program, or GAP, and many other federal programs that Red Lake relies on to support our tribal members. As we begin to shape the FY 2018 Appropriations Bill, Red Lake requests that you consider the following. First, the legal and moral trust responsibility requires Congress to appropriate funds at the level needed to meet basic needs of tribal communities like Red Lake. Red Lake and the United States are parties to several treaties by which Red Lake conveyed millions of acres of land to the United States in exchange for Red Lake's basic needs being met in perpetuity. Yet by every measure, our needs are not being met. We have too few job opportunities, inadequate infrastructure, shrinking public safety, healthcare services. We are fighting against violence, drug abuse, mental health dysfunction. Second, the U.S. Congress should uphold treaty obligations, regardless of political disputes over federal budget cuts and deficits. This means you should protect Indian country budgets from the White House proposed 12% cut to the 2018 Interior budget. It means you should add funds back to restore BIA, IHS, and base tribal government funding to make up for the cuts in reservations program caused by years across the board sequestration. Third, we ask that you increase funding for programs that are bringing Red Lake success. BIA's TOAHI and recidivism reduction initiatives are two initiatives that Red Lake has put to maximum use. Because of these programs, we have opened a juvenile treatment facility, a tribal health wellness program, providing a vital service to our youth for a variety of issues, including mental health, substance abuse, domestic abuse, and petty crime. Before 2 years ago, I was here to testify about suicides. But we are proud to report in the last 16 months, for the first time in years, we have had 0 youth suicides. 0. This outcome is the direct result of our hard work with the funding you provided for the TOAHI and Recidivism Reduction Initiative programs. And I want to say, Chimigwech, thank you again to members of this subcommittee for your steadfast dedication working for with Indian country. Again, Chimigwech to you all listening today.
Thank you, and thank you for your testimony. Next, Kevin, is it Dupree? Dupree, Chairman of the Fond du Lac Band of...
Fond du Lac.
Fond du Lac, okay.
Bonjour, naganamus and disnakas nagachiwa nangin juba. Migizu dotem. First of all, I'd like to thank everybody for allowing us to come here and speak our mind. I'm not used to reading off a piece of paper. Within our culture and our traditions, it's always talk from the heart, and so you can't put the same things on paper. So I'll try the best that I can. And I'm really nervous about sitting in front of a clock that has to tell me I can talk and when to stop. So, good morning. I'm Kevin Dupuy. I serve as the chairman of the Fond du Lac Band of Lake Superior, Chippewa. I want to thank this committee for inviting me to testify today and the good work you have done over the years, especially this year, to make sure that the needs of Indian country are being addressed. We have a small reservation in northeast Minnesota. We have 4,200 tribal members. We provide government services, including healthcare, education, public safety to 7,300 Indian people in our region. We use tribal funds and partner with other governments and private entities to do much of this work. But these are not enough to address the needs. Federal funding is essential. We're battling a long history of poverty and related problems that arise from poverty. We're making progress. We see improvements in student achievement and health of our people. But progress is very slow. We have yet to close a large gap between Indian people and Minnesota population overall. We still suffer from higher rates of poverty, unemployment, diabetes, and heart disease that statewide population. Much more work still needs to be done. Education, including preschool and after-school programs, opens the door for our children to move past the poverty and achieve. But without sufficient federal funds, we cannot hire, retain qualified teachers without sufficient federal funds. We cannot maintain school buses or schooling or the school building itself. The school also helps protect our children from crime. We are on the front lines of fighting the drug epidemic. Our small rural community is seeing an influx of heroin, opioids, and meth that are poisoning our people. Our school provides programs and safe haven for children. Over the years, our police department has assisted the school by assigning it an officer to prevent juvenile crime. At the same time, our police must also respond to and investigate the growing numbers of incidents, many of which are drug-related. The funding that the federal government provides to tribes to help cover the cost of law enforcement salaries and equipment is key to this work. The drug epidemic has also increased demands on our clinics. We have worked very hard to build and run clinics that can provide a broad range of care. We have programs to help combat substance abuse, but because of the drug epidemic, more is needed. Our healthcare provides programs that are funded only 33% of the level of need. Our clinics work hard to fill the funding gap by third-party billing so that we are repaid by insurance companies and Medicare for the health care we provide. In fact, third-party billing through Medicaid are very important sources of funding for our clinics. If the law changed and the Medicaid dollars were cut or simply block grant to the state, our clinics would suffer substantial losses. We would only be able to maintain the current level of care by very significant increases in IHS funding. Finally, the healthcare and welfare of our people are directly tied to natural resources. This was true at the time of our treaties with the United States and remains true today. To ensure that we could sustain ourselves and our families, the United States and our treaties promised that we retain the right to hunt, fish, and gather natural resources, both within and outside of our reservation. Our members rely on these treaty rights to put food on the table. This is especially important for many of our people who are unemployed or live at or near or below poverty. Natural foods like wild rice, fish, game, and berries also improve diet and health. The use of these natural foods are an important part of our nutrition programs taught in our clinics and schools. These natural resources are also essential to our way of life and our culture. Given the importance of these resources, we actively work to protect them from harm. We cannot eat fish that are high levels of mercury. Our wild rice will not grow in waters that have high sulfate levels. Far too many waters in Minnesota are impaired. Federal funds provided through the Interior and EPA for natural resources management and environmental protection are essential for us to restore waters, prevent pollution, and improve wildlife habitat. Unfortunately, funding has not kept pace with the need. The federal investment in the environment also improves the economy. The funding for the Great Lakes Restoration Initiative is a good example. By cleaning Lake Superior, we improve commercial fisheries, enhance tourism, and propel the hunting and angling industries, a business that generates $73 million each year. This creates jobs in a region that desperately needs them. We are very worried about the deep cuts that the President is proposing for the federal budget. We are concerned that the new administration has not yet had time to learn what these important programs do or how effective and vital they are in Indian country. We are very grateful for the work you did to preserve the increased funding for these programs in 2017, and we urge that the same be done for 2018. Thank you. One quick note. As a former Secretary Treasurer of Fond du Lac, I have come to several hearings to testify, and we have to come here to ask for things that should have been promised to us or promised to us. I believe that there should be a large campaign to go over the program or the formula for funding on the base of the unmet need, because we know that the formula is wrong and we're not receiving that funding. And most importantly, when we come here, it's not about listening. We want you to hear us. There is a difference. We want to be heard. Miigwech. I'm happy to answer any questions.
Thank you, and thank you for your testimony. Obviously, there's some discussion about the budget, the upcoming budget that comes in June or late May, and I used to serve on the Budget Committee with Chairman Cole, and he still is doing a great job representing us all on the Budget Committee. And but at some point, I hope we can come to what we call around here a budget agreement, because that's what we need to do. And between the Senate and the House and the President, and so where we can get unshackled from the sequestration and move on to a more logical budget process, which I'm sure Chairman Cole agrees with. It's just we have to get everybody to agree to do that. But that has a lot of the problems that we're having around here is it's not just in Indian country, but throughout the federal government. Unemployment, as I know, is a big issue and throughout Indian countries, especially in your areas. 50% unemployment is huge. Obviously, that leads to a lot of other problems, I'm sure, in that part of the world, and so it's something that we're concerned about. And Great Lakes cleanup, trust me, there's a gentle lady right over here next to my left that continually makes sure that we have the money that is necessary for Great Lakes cleanup, and we have been doing that, and we intend to continue to do that. So we'll keep that in mind. With that, Ms. McCollum.
Thank you, gentlemen, for being here. I appreciate the fact that you both brought up the environment and the federal role in working with tribal governments, tribal DNRs, as well as the work that the tribal governments do with the state DNR, and bringing up the issue of SALFA has been something that I've been watching the best that I can. There was very poor consultation with the tribes when the state was looking at changing the sulfa levels and the way it would affect the wild rice. It's like, well, we think it'll be okay, and if you lose your wild rice, you not only lose one of your first foods, but for many of the tribal nations, it's also economic income, it's employment. So I hope that the consultation will be good with the new Trump administration, but I think it's something we have to be vigilant to make sure that it happens. And what's the timeout that's happening with the Forestry Service, with the national parks, the Department of Interior right now with the proposed copper sulfite mine up in the area. See, our water flows north. And so sometimes people look at these mines and they go, well, that's not a problem because the water's going to drain that way and there's nothing happening. Well, where we are on the Laurentian Divide in this part of the state that these gentlemen are talking about, the water actually flows north. So it flows up into their watershed, up into their water district. So we hope that this timeout to really study its effects. I almost called you Mr. Chairman, Mr. Secchi. I don't want to be too informal here. The new tribal college that at Red Lake that was mentioned in some earlier testimony, and how there was funding needed for that. If you could perhaps maybe elaborate a little more to the committee on that. There's 2 colleges that are being stood up, and we need to make sure that the full commitment for the funding's there for those colleges. And I know Fond du Lac also has a very strong interest in making sure that funds are there for the college. But that's part of how we work on entrepreneurship and for unemployment, and that is to make sure that Native American students have appropriate colleges. Could you maybe just for a second talk about what your concerns are with if the funding isn't there for what happens with the big investment that was made?
Well, our Red Lake Tribal College is going well so far, but recently we were put in on accredited status to get accredited, and it's gaining some dollars. However, it needs more dollars for operation, and our students are increasing, and it is a good college, and it's going to be great once we get all the paperwork in place that what we need to be full accredited. And we need, like you, to give us hope and help to create this opportunity for our tribal members to go to college. But not just Red Lake, there's others that come from different areas that come to that school. If that helped any.
The suicide prevention programs are working, but you just can't shut those off with a switch and hope that they can continue. So thank you for speaking so.
These programs, Te Wahi and recidivism, these are great for our youth. It helps them. And like Mr. Calvert talked about unemployment, that creates our membership going into drugs. Drugs is not part of an Indian country, but it happens. That goes to suicides, overdoses, bullying. This should not be. Continued broken promises from the federal government creates these shortfalls for our tribal membership. There's treaties in place, and their contracts, they should be abide by. These treaties were set by your ancestors and our chiefs, and they're still there, and they'll never go away. And you guys got to remember that. Treaties are very important to Indian country. So consider that. Consider both of our testimonies. And I want to say, Chimigwich, thank you for allowing me to come over and speak again. And I did here a couple of years ago, and whenever invited, I'll be back. Miigwech.
Thank you, but Mr. Cole?
Well, a couple of things. I just want to thank both gentlemen for coming. It's extremely helpful for this committee to get firsthand testimony. And number two, and I'm sure you do this. Matter of fact, I know you do this, but I hope you're talking to other members as well, because unfortunately, many of our colleagues don't represent parts of the country that have strong tribal presence and traditions, and so they really need to hear this. And they need to understand the importance of these agreements and treaties and the rights of tribes. Sadly, you know, our history tells us treaties aren't kept very often, frankly. You know, the history of my people would be a lot different. I'd probably be a Mississippi congressman instead of an Oklahoma congressman if people kept treaties. Or I wouldn't be a congressman at all because we wouldn't be a state if people kept treaties. That was never supposed to happen in Oklahoma. But it did because people, you know, routinely violated treaties. So you're right to be here reminding us of the obligation because it's certainly been forgotten plenty of times in the past. But please do on these budget items, and I just want to end up where Mr. Calvert was on that. There'll be some proposals out, but in the end, Congress sets what the budget's going to be, not the White House. And it's extremely important that members hear that not to blindly follow, you know, what comes out of the White House, but to remember there's a whole set of obligations here that need to be adequately funded. And this committee has shown what it will do with the dollars it has, but if its allocations get cut, then it's going to have to make a series of tough decisions. So again, we're used to doing tough decisions. That's what you get paid to do, but you have to have enough money to cover the obligations that both of you spoke so eloquently about. So that yield back.
Thank you, and thank you both for your testimony. We appreciate it.
I'd like to comment on Mr. Colt. I'm going to be doing 6-7 visits while I'm here today and tomorrow. So
good. Great.
Bobby, yeah.
Appreciate that.
That's
why
Thank you.
I have a pretty good idea what your schedule's going to be like. I almost feel sorry for you.
Thank you. I appreciate your testimony. Next, we're going to have Robert Miguel, Chairman of the Ak-Chin Indian Community. Robert Tahasi Hill, Business Committee Member of the Oneida Nation of Wisconsin. Aureen Martin, Board Member of the National Indian Child Welfare Association. And Lloyd B. Miller, Counsel, National Tribal Contract Support Cost Coalition. How y'all? Seems like we see you guys every year, so we all know you. We appreciate your coming. Mr. Miguel, Chairman of the Ak-Chin Indian Community. Welcome. Recognize.
Is it on? Okay. It's red? Yeah? Okay, thank you. Good afternoon, Chairman Calvert, Ranking Member McCollum, and members of the subcommittee. I am Robert McGill, and I'm currently the elected chairman of the Ak-Chin Indian Community. We are a small tribe of 1,067 enrolled members, about 80% of whom live on the reservation 30 miles south of downtown Phoenix, Arizona. Our ancestors were farmers, and we are still farmers today. In fact, the name Ak-Chin is an O'odham word that refers to a type of farming practiced by our ancestors. While the farming methods have changed, we still run a 16,000-acre farm that provides jobs for our people, income for the tribe, and food for people around the world. As we preserve our heritage and respect our history, we are also inundated by growth and its associated challenges. The population of our neighboring community, the city of Maricopa, has grown from 1,040 people in the 2000 census to over 50,000 today. It has been staggering growth, and we have self-funded many projects to help both the tribe and surrounding communities adapt, including the central plant, wastewater treatment plant, surface water treatment plant, roads and infrastructure projects, and most recently our multi-purpose Justice Complex. The Justice Complex is truly a state-of-the-art 50,000 square foot facility. It houses the community's police department, public defender's office, prosecutor's office, detention and probation center, and courts all under one roof. As I testified last year, we built this $18 million facility ourselves because the backlog in the BIA justice construction budget is so long that our grandchildren probably wouldn't even live to see it completed. From the beginning of the design phase, our community has worked hand in hand with the BIA to ensure the facility was being built in full compliance with all agency and health safety requirements. Compliance with these codes is the only requirement in the BIA regulations or handbook necessary to be eligible for BIA operations and maintenance or O&M funding. The facility was certified to be in compliance with all BIA codes when it opened in June 2014. However, when we reached out to people at the BIA who had been advising us on how to meet all requirements necessary to receive O&M funding, we were met with silence and then told to talk to another BIA office. This runaround has been going on for almost 3 years now, and we still have not received 1 cent of O&M funding, not even what we were receiving for the old facility that was replaced. As we continued to press for O&M funding, we learned that the BIA was denying all PL 638 requests for new funding. Beyond the inherent unfairness in the notion that tribes can only be eligible for funding if they are currently receiving it, this practice presents some serious long-term policy challenges we hope this subcommittee will work to address. We are certainly not alone in our need to replace aging infrastructure, and many other tribes are going to have to start self-funding projects in the future. This will apply far beyond justice-related projects, but also the schools, roads, sewage plants, hospitals, and other infrastructure projects. If such tribes are going to be denied O&M funding outright, as we have been, not only is the BIA penalizing tribes for taking on this substantial expense and responsibility, but it would also be a disincentive to follow BIA health and safety codes in the construction process. We hope this subcommittee will help us push the BIA to embrace and encourage tribal innovation and self-reliance. Instead, we are currently being penalized for exercising our sovereignty and taking on the cost of a project that should otherwise be a federal trust responsibility. Our experience is not unique here. Until Congress forces some changes on the BIA, tribes will continue to be treated unevenly and be penalized for taking on BIA responsibilities and building new projects. Thank you for holding this hearing to directly listen to the most pressing needs of tribes across the country. My community has high hopes that this committee will continue its good work to address the challenges tribes face and help shape the BIA into an agency that is more flexible and responsive to the ever-changing needs and capabilities of tribal governments. If I can, subcommittee, we have some photos here of our judicial facility. That's the current facility now. That was the old one. So exactly. And then I believe we also have photos of the inside, the old facility. That's the older facility there. And the second one is the new facility today. And again, we funded this all by ourselves because we had to. So again, I thank you, Chairman Calvert, Ranking Member McCollum, and members of the subcommittee for listening to us today.
Thank you very much for your testimony. Beautiful new facility. Next, Ron Tahasi Hill, Business Committee Member of the Oneida Nation of Wisconsin.
Suguli Swagweka de Hasidas ni Yungyats Onyota Aga ni Alkali Wagasle Wage ni Witaloda. Chairman Calvert, Ranking Member McCollum, Mr. Cole, thank you for this opportunity to appear before you today. It is an honor to be here on behalf of more than 17,000 members of our community. I'm here to make 3 requests. Number 1, incorporate self-governance into a greater number of tribal programs. 2, restore funding to the Great Lakes Restoration Initiative. And 3, to protect the EPA's Tribal General Assistance Program. I will begin with our most broad request, tribal self-governance. Tribal control and distribution and administration of federal funding must be expanded. At Oneida, we have assumed the responsibility for our healthcare, education, and most BIA programs. This means that the tribal government, not the BIA, administers our grants. The result has been unambiguously positive. Environmental, health, and education indicators have all gone up, while administrative costs have gone down. Just as important, our tribal government capacity has also improved. Our staff now have the knowledge, skills, and experience to take on new, more complex governance operations, and they do so on a regular basis. Congress needs to learn from our experience and expand the scope of programs that are eligible for self-governance. For instance, the Department of Health and Human Services allows Indian Health Service functions to be contracted out to tribes, but the same department prohibits tribal governments from running TANF or Medicaid programs. Similarly, USDA, Department of Homeland Security, Department of Justice, EPA programs should all allow tribes to receive direct funding rather than have their grants passed through states. Self-governance is a good policy and is a good practice. It ensures that scarce federal dollars are used to build capacity rather than bureaucracy. And it also makes good on the United States' sacred obligation to respect tribal sovereignty and allow tribal governments to manage our own affairs. Our second request is to do with the EPA Great Lakes Restoration Initiative. Oneida Nation's creation story teaches us that everything is connected and there must be balance for the environment to thrive. It is this ethos that has led us to become long-term partners with the Environmental Protection Agency on the Great Lakes Restoration Initiative. Oneida Nation has been awarded nearly $4.5 million for watershed improvement projects. In short, this initiative has been the single most successful federal program designed to restore our lands. Given this enormous success of the program at Oneida and across the Midwest, it is also deeply concerning that the President proposes to virtually eliminate funding for this initiative in FY18. This could be a catastrophic mistake. It would hurt our fishing, tourism, and agriculture industries, and it would put into jeopardy hundreds of millions of dollars of investment from state, local governments, as well as the private sector. Oneida Nation of Wisconsin strongly urges the committee to reject the proposed cuts to the program and restore it to the FY17 funding levels. Lastly, I urge you to protect the EPA Tribal General Assistance Program. This program helps tribal communities build technical capacity to manage our own environmental programs and ensure that we have a voice on national policy decisions that affect our land, air, and water. At Oneida, this funding allows us to expand our environmental staff. We have used the funds to hire an area environmental manager and cover parts of the costs of a wetland program manager as well. This not only protects the health of our members and improves the environment, it also supports Oneida sovereignty. Perhaps even more important, the GAP grant helps offset the cost of interacting with the EPA and other federal agencies on environmental policy issues. As a member of the Regional Tribal Operating Committee, I witness how important this funding is firsthand. At least 3 times a year, my colleagues on the RTOC and I meet with EPA to identify how policies may impact tribal governments and tribal lands in our region. In fiscal year 2017, Congress appropriated $65.5 million for GAP. I ask that the committee maintain this level of investment next year. Significant cuts below the current funding levels will directly and negatively impact the environmental health of tribes across the nation. In conclusion, there are dozens of other programs that are vitally important to Oneida Nation in the Interior Appropriations Bill, but in the interest of time, I will conclude my remarks here. Thank you again for this opportunity, and I look forward to working with you to ensure that Indian country can continue to thrive in fiscal year 2018 and beyond. Yanko.
Thank you. Irene Martin, National Indian Child Welfare Association. Welcome.
Thank you.
You're recognized.
Good morning, Mr. Chairman, Congressman McCollum, and Congressman Cole. As you know, I'm Irene Martin, and I'm a member of the Bad River Band of Lake Superior, Chippewa, and I'm here today on behalf of the National Indian Child Welfare Association, or NICWA. As you know, NICWA is a national organization representing American Indian and Alaska Native families, which specializes in public policy related to Native children and families. Our mission is twofold. First, it is to address the issues of child abuse and neglect through training, research, and policy development. Our other focus is to support compliance with the Indian Child Welfare Act. I'm here today to talk to you mainly about Bureau of Indian Affairs programs serving Native children and families. So one thing we all know, and it's well known, is that Native children are placed in foster care at a much higher rate than the general population. So in some states, 10 times higher than their representation in the general population. In a state where you might have 1% of natives, there are 10% of the foster care population is Native children. But tribal governments seem to have some of the most limited funding of all governments for dealing with these issues. And we know, and studies have shown, that tribes are actually the best entity at providing services to prevent foster care, and once kids go into foster care, for finding them the services and the placements that they need. So it's for these reasons that we provide our recommendations. Our first recommendation is to fund Indian Child Protection and Family Violence Prevention Act programs at the fully funded rate of $40 million. And I've come here a few years now, and we always talk about this. But these two programs are really our highest priority because they're unique. They're the only programs in federal law that authorize direct funding to tribes for domestic violence prevention and for treatment for child abuse victims. And the law creating these programs actually was originally passed in 1990. It really had two purposes. One was to increase the identification and prevention of child abuse and neglect and domestic violence on the reservation, and the other was to provide funding to treat and prevent child abuse and domestic violence. So on the one side, the Act actually provided for mandatory reporting requirements for people who interact with children, teachers, police officers, which weren't there before. The other thing that it did was to create these programs. The Act has been actually very successful in identifying child abuse and reducing those numbers. And it's enjoyed tremendous support from Congress. Last year was actually, protections were expanded to cover foster care parents and background checks for foster care parents. But the treatment side of it has never been funded, and so we're asking that for both programs, the family violence prevention and the abuse treatment for children, be funded at $40 million. Our second request is that ICWA Title II funding for on-reservation child welfare services be increased from $20 to $30 million. So when the Indian Child Welfare Act was passed in 1978, the idea behind authorizing these programs was to provide base funding for tribes to be able to provide basic social services for their families. And I think it's been extremely successful in that. But these child welfare programs work with some of the most at-risk and needy members of our society, but the funding level is such that almost every tribe gets the funding, but they only get about $30,000. And with that $30,000, they're expected to provide child protective services, family reunification and rehabilitation, case management, foster care recruitment and retention, and adoption services. Most instances, that doesn't even fund a person full-time. So we're asking to increase that amount from $20 to $30 million. And, you know, if you just do the basic math, that could probably fund one person at least full-time for a year. Our other recommendation, our final recommendation, is that Title II funding for off-reservation services be funded. It was previously funded, but that ended in the mid-90s. The thing is that off-reservation populations have increased since the ICWA was passed in 1978, from 37% of Indians at that time were living off-reservation, and now it's over 67%. These programs actually provide a bridge for folks living off the reservation with their communities, and it can help provide programs and placements that, you know, state workers might not otherwise find. So those are our requests. We feel it's imperative for tribes and off-reservation child welfare programs to receive increased base funding because of our increase in our number of people and the people that are moving off reservation. So this concludes my remarks. Thanks for having me today.
Thank you, and thank you for your testimony. Next, Lloyd Miller, National Travel Contract Support Cost Coalition. You're recognized for 5 minutes.
Thank you, Mr. Chairman. Ranking Member McCollum, Congressman Cole. Thank you for inviting me again to talk about the contract support cost issue. This issue 5 years ago was nearing a disaster. There was a collision between the efforts of this committee and the dictates of Supreme Court decisions in the Rama and Arctic Slope and Cherokee cases. But over the course of 5 years, this committee did heroic work, truly heroic work, and fashioned a unique solution which protects program funding, fully funds contract support costs, and eliminates the problems that really bedeviled the committee and the courts years ago. So I truly salute the committee, and you'll hear in my testimony today remarks more in the nature of oversight than changes that are needed in law or appropriations. 3 things I'd like to touch upon. First, the agency's policies have now been finalized. It's taken them 4 years since the Supreme Court decision, but at the end of 2016, in the last administration, they completed their 2 policies, the Indian Health Service and the Bureau of Indian Affairs policies on contract support costs. I also want to talk a little bit about the domestic violence, substance abuse, and related programs, and the contract support cost obligation associated with those programs. And then thirdly, we'd just like to talk about the appropriation structure itself and the estimating problems that have come up. So first, the policies. These are the 2 policies. I didn't want to burden the members of the committee with copies, but I'll provide the chairman with a copy. You'll see.
Submitted for the record.
Thank you, Mr. Chairman. The BIA document is about 5 pages. The Indian Health Service document is about 20 pages. That tells you everything perhaps you need to know about what worked and what didn't work. To be fair, the policies are good. Nothing's perfect. The policies are good, but the Indian Health Service policy is too complex, too unworkable, and the agency is poorly staffed to deal with the complexities that are reflected in that policy. This committee has been excellent in urging the agencies to continually simplify the contract calculation process. I think your directives, again, would encourage the Indian Health Service to chop that 20-page document down to 10 pages and make it a little bit more workable. At the same time, the agency ought to be directed to direct some real resources into this area. They now have one person in headquarters due to the reassignment of the second person to a different position. One person left in headquarters who's also serving as an acting director of one of the divisions within the agency. This is not good when you have 350 tribal contracts around the United States, many of them representing multiple tribes, such as the California Intertribals you heard today. This is not proper staffing for this important account, and I know that the committee wants to be sure that there's absolute accountability on these funds, and that can only happen if the agency is properly staffed. So I would respectfully request that the committee consider directing the agency to staff up this account from within the existing budget. Secondly, I wanted to talk a little bit about the domestic violence, suicide prevention, and related funds. The committee, in response to calls from tribes, eliminated a notwithstanding clause. The notwithstanding clause, which had appeared in the Appropriations Act a few years back, had been used by the agency to discontinue calculating contract support costs on those funds. Now, contract support costs consume about 25% of those funds. So if those programs have to cut 25% to manage the contract support burden on those programs, there's that much less funding. And as it is, the funding is quite low. It's very modest funding. There was a $4 million increase in domestic violence, a modest increase necessary to require those programs to absorb their overhead, unlike any other BIA program or IHS program, is really not reasonable, doesn't serve the purpose of the program. And it isn't what the agency itself did. The agency on its own in 2012, after the Supreme Court decision, incidentally, discontinued the practice of calculating contract support costs on those funds and discontinued the practice of paying those funds to the tribes through their existing self-governance contracts, require them to do grants and incur additional burdens in the way of grant reporting. All of that can be undone. I think it will be undone now that the notwithstanding clause has been removed, and all I'd ask for is that the committee monitor the agency's behavior, and as the grants expire and need to be renewed, that instead funds go into the self-governance compacts and the 638 contracts, and contract support cost gets calculated on top of it. Frankly, it's not a very large number in the large scheme of things, certainly not in comparison to the two appropriations. And the third thing is the appropriation structure. And on this, I think we are all a little disappointed that the Indian Health Service, if I may have a few extra seconds, Mr. Chairman.
Go ahead.
The Indian Health Service missed the mark in 2017. They predicted that the contract support cost requirement would be in the neighborhood of $800 million. Our own experts have calculated that it'll be far lower than that, perhaps close to $700 million. I think I've detected one of the problems. And it may be that the two were not speaking the same language. The Indian Health Service calculates what the total contract support cost requirement is nationally. But part of that requirement is not in the contract support cost account. It's actually covered by agency dollars to the tune of about $50 million. That could account alone for a $50 million error. And that's my fear, that perhaps there was just some miscommunication. I am confident this is not going to happen going forward. The agency has acknowledged its error, and I think it may provide some grease in the mechanisms as you go into 2018 and worry about a severe restriction in your allocation. Thank you, Mr. Chairman and Ranking Member McCollum.
Thank you. Thank you for your testimony, and we appreciate your coming out today. Mr. Miguel, I've been by your reservation outside of Phoenix. It's not too far from where I am at in Southern California, and I know you have a substantial farming operation out there. And I'm always surprised, Maricopa is just, do you own the land around Maricopa?
No, we don't. Actually, they were our original lands. We were 40,000 plus acres when we were first established. 6 months after we were established, the president tapped at that time I'm sorry.
Put that mic near you.
It was, I'm sorry. Yeah, we actually, if you think about it, the city of Maricopa is our original lands. When we were first established back in the 60s with President Taft, we were a 40,000 acre tribe, but 6 months after we were designated the 40,000, it was rescinded and we were reduced to 22,000 acres.
Okay. Another one of those treaty violations that Mr. Cole
Unfortunately.
talked about. But you've been very successful with the 22,000 acres that you have remaining, and I recognize we have commitments to you, and we'll certainly take a look at that as we move this process along. We've been talking about the Great Lakes all day today, Mr. Hill, so we're on it. We're on it, and I know you've done a great job of self-government at the Oneida Tribe, and so we believe in self-governance around here. So we know you have the Indian country has the competence to run their own affairs. We should allow them to do so. And Aureen, you're right. We need to, child abuse and neglect is unfortunate. You have to separate the children from that, and that's a big problem throughout Indian country. We see a lot of that. We have Sherman Institute where a lot of these children are separated from their parents if they're exposed to that kind of treatment. Unfortunately, as you know, unless you deal with that, it tends to be generational. So it's a huge problem, and we need to deal with that. And Mr. Miller, you come out every year, and we appreciate your oversight and what you do, and letting us know what we need to do with oversight. So there's a lot of challenges out there. We talked about substance abuse. This opioid epidemic is terrible. It's what the former chairman of the full committee has been a big advocate of what we can do to fix this. But over 1,000 deaths a day, 1,000 deaths a day around America with opioids, and I forget this other drug that was a elephant tranquilizer. It's anyway, just a small gram of it can lead to instant death, and it's just a horrific situation. So we need to get a hold of that. And unfortunately, Indian country is not immune from that scourge. So, Ms. McCullum.
Thank you, Mr. Chairman. The EPA grants, and I'm very proud of the Great Lakes nations who have been up here testifying, but it just goes to show the obligation for maintaining clean water, drinking water, water for habitat, not only in the Great Lakes but throughout the United States. And the work that the EPA does with tribes, if the EPA's budget's cut too much, so that can't happen, it's going to affect quality of life and a lot of programming, and quite frankly, a lot of jobs, good jobs that tribal governments have stood up with their own departments of natural resources. But it is it's a dependent organization. They cannot do it without the federal EPA being there. Fish and Wildlife as well, and I know that many of the tribes in some parts of the country are also looking to set up more robust relationships with the National Park Service, with some of the monument interpretation and other things moving forward. So I thank you for you sharing that. So I just want to, and I can reread your testimony. So in the urban settings, Ms. Martin, where we're working on home placement, or appropriate tribal placement for children, there's a missed opportunity because of the way the dollars flow?
Yes, that's true. ICWA authorized these off-reservation, this funding stream for off-reservation programs, and it was funded until 1996, I want to say. And what those programs would do is they would provide a connection for state workers who are looking for placements or trying to find out information about a family, or even to provide services. And then when that stopped being funded, that's just a gap. And the problem is that we have a huge increase in our urban populations now over time, where it's basically flipped. We used to have, a minority of our members would live off reservation, but now it's up to 67% during the last census. So we know that people are falling through the cracks on the urban setting if those tribes that are on reservation don't have outreach programs. And there are some tribes that do, like Oneida, but not every tribe is able to do that.
Okay. Well, I'm going to talk to the folks at Little Earth and learn a little more about that. And I'm sure you have somebody I can talk to. Thank you, Mr. Chairman.
Thank you. Mr. Cole.
Just quickly, I want to thank all of you for coming. Some of you are regulars here. In fact, all of you are regulars here. But that is so helpful to this committee and to its staff just over time, those relationships and that information. And Mr. Hill, I want to go back to a point you made, and really, Ms. Martin, you sort of reinforced it, but it's a pretty common theme, and usually Indians do better at running their own affairs than somebody in Washington does. I know in my tribe, I've seen it over and over again. If nothing else, if there's a mistake, it's so much easier to correct if the people responsible for it, or you can get to your tribal legislator pretty quickly, as opposed to some faithless bureaucrat 1,300 miles away. So putting as many of these resources in the hands of the people that are actually on the ground running programs just makes it so much better and so much more responsive and self-correcting. So. Yeah, I know that point of view is shared by everybody on this committee, and where we can do things to, again, push down the decision-making to the tribal level, we're just always better served every single time. So anyway, thank you for your consistent advocacy and your role in educating all of us to the concerns, and hopefully over time, as Mr. Miller suggested, the arc has bent in the right way. I mean, we really have tried on a bipartisan basis here on the successive chairman to try and do the right things. But if you hadn't been going to the Supreme Court asserting your own rights, the right thing wouldn't have gotten done. So, I mean, that active participation using the tools that are available obviously through legislation, but sometimes through negotiation, sometimes through litigation. Those things are all necessary, and all of you are to be commended because you've done it not only for your respective tribes, but for the good of Indian country in general. It's made a big difference. So thank you.
Great. Thank you. And thank you for your testimony. This concludes our morning hearing. Thank you for making the effort to be here this week. Our next hearing begins at 1 o'clock this afternoon.